But he knows better than that. We all know the federal government doesn't pay for abortion care. We all know Republicans have already decimated access to safe abortions in this country. So what does this provision actually do? It further defunds women's health care. It defunds cancer screenings, prenatal care, postpartum services, fertility treatments, preventative care. 96% of Planned Parenthood's clinical work has nothing to do with abortion, but everything to do with serving millions of women, most of them overwhelmingly in rural and underserved areas, who are having a hard time finding reproductive care or any health care, especially in states with abortion bans. Faced with the choice of either breaking the law or breaking their oath to put patients first, OBGYNs are packing up and leaving. As a result, 35% of counties in America don't have a single obstetrician. In Georgia, it's 42%. In Texas, it's 50%. Clinics are shutting down while maternal mortality is on the rise. Infant mortality is up for the first time in decades. How does this bill respond to this Republican manufactured crisis? It piles on. It makes it even harder for women to find health care. Without this amendment, it would shut down nearly 600 health centers run by Planned Parenthood, 64% of which serve women living in medical deserts. These are communities that don't have enough healthcare providers as it is. These are women who overwhelmingly live in rural areas. These are women that you represent. If Planned Parenthood is defunded, 7,500 South Carolinians will lose their doctor. All of them, 100%, live in a medical desert. 9,200 Georgians are on the edge of that same cliff, 75% in medical deserts. 22,000 Hoosiers, 82% medical deserts. 24,000 Virginians, 50%. 37,000 North Carolinians, 67%. 51,000 Minnesotans, 69%. And 118,000 Texans. Count on Planned Parenthood in a state where babies and pregnant women are dying at a historic rate. 2/3 of Texans live in medical deserts, and 141,000 New Yorkers are about to see 47 clinics boarded up, 61% of them in the neediest areas in New York State. Millions of women are counting on their representatives to make the right decision. Women like Cheryl from North Carolina, who years ago was overdue for a pap smear, but she didn't have insurance and she kept putting it off. A friend mentioned Planned Parenthood would provide this free of charge. She booked an appointment, got checked, and it came back abnormal. They caught it early and the cancer was removed. Cheryl credits Planned Parenthood with saving her life. A lot of stories begin like Cheryl's. They should all end in the same way, with health care that saves lives. I hope this amendment gives you all pause. When the women in this country deserve health care, and I hope you will think about the moms struggling to get by and stay healthy for the sake of their children and their families. It is not too late. Do right by them. Make this amendment in order for floor consideration. Thank you, Madam Chair.
Thank you. Mr. Aguilar.
Thank you, Madam Chair. Ranking Member McGovern, distinguished colleagues on the committee. I appreciate your kind words about our colleague, Mr. Connolly, as well, Madam Chair. I'm grateful for the opportunity to introduce amendments that would strengthen SNAP, a program that helps families across the country meet their basic needs. I'm also proud to co-sponsor Leader Jeffries' amendment. State governments can't afford to take on the extra costs that this legislation would impose on them. It would force leaders in red states and blue states to either raise taxes or remove people from SNAP, leaving even more Americans hungrier and poorer. I wish more Americans had the opportunity to hear from our prior panel's testimony during the workday, but this committee made the choice to hide from the public and keep hidden what's actually in this bill. In fact, we're still told that managers' amendments are still being negotiated and are incomplete. It is outrageous that this committee is debating these policies under the cover of darkness, but it shouldn't be surprising. Legislation you intend to pass, started at some ungodly hour, kicks millions of Americans off their health insurance and takes away food assistance for families who need it most. As grocery prices rise, I cannot understand why my Republican colleagues want to take food out of the mouths of mothers, children, and veterans while making healthcare even more expensive. House Democrats are eager to take on waste, fraud, and abuse throughout the federal government, but we cannot find a willing partner on the other side of the aisle because of our colleagues' single-minded focus on cutting healthcare for people who need it most. This legislation doesn't make Medicaid or SNAP more efficient or more fair, Madam Chair. All this bill does is ensure that billionaires who have never had to worry about a hospital bill or putting food on the table can continue to pay less in taxes than a teacher, a firefighter, or a nurse. Madam Chair, it is a fact that only House Democrats want to make healthcare more accessible and more affordable for everyone. We will continue to fight back against this effort to drive up costs of health insurance and end basic needs programs just to make a group of campaign donors happy. The contrast is clear. House Republicans are making healthcare more expensive and less accessible. House Democrats want to ensure that every American can earn the peace of mind of a good paying job with great benefits. I yield back, Madam Chair.
Thank you. Mr. Aguilar, would you mind leaving your testimony with me? Because I don't believe I heard a couple of things that you said, and I just want to look at it before I make any comments.
Of course.
Okay, I want to double check that I heard some things that I think you said
Okay,
before I make any comment.
of course.
I'm going to recognize, before I speak, I'm going to recognize any of my colleagues. Ms. Houchin, Mr. Langworthy, Mr. Scott, you're recognized.
Madam Chair, I would just like to ask unanimous consent to submit for the record an article entitled Rich State Poor People. And if I might,
Without objection.
if I might just read from it, the oil and gas has helped New Mexico has become the nation's second biggest oil producing state. Taxes paid on the state's oil production will generate, and in quotations, more money than we know what to do with, according to Democrat State Senator and Legislative Finance Committee Chair George Munoz. States are flush with cash that are well worth. Thank you.
Without objection. Mr. McGovern, you're recognized.
Yeah. First of all, let me just address something that Chairman Smith said. He went through all the things in the tax section of the reconciliation bill that, quite frankly, most of us support. I mean, the child tax credit, the no tax on tips, the middle class tax cuts. But what he omitted was tax cuts for billionaires. What he omitted were the cuts to Medicaid that will throw people off of healthcare, or the cuts to SNAP. Leader Jeffries, I mean, we're reasonable. We're happy to work with them, but there's no way in hell we're going to support a bill that's going to throw 14 million people off of healthcare, or throw millions of people off of SNAP. Maybe you can maybe comment on how would children, how would seniors be impacted by the legislation that is before us?
Well, thank you, Mr. McGovern. This legislation would rip healthcare away from approximately 14 million Americans. including millions of children who will be adversely impacted by the fact that Medicaid is being cut in the greatest numbers in American history, children who would otherwise be able to see a doctor when they're sick, but might not be able to as a result of Medicaid being ripped away. Children who will no longer have the ability to receive preventative care that could catch things early enough to avoid serious illness or death. They're impacted by the GOP tax scam. Seniors, of course, who will have their Medicaid ripped away from them will also be adversely impacted because the majority of seniors who receive nursing home care in America or home care in America, these aren't statistics, it's our parents, our grandmother, our grandfather, our great-grandmother and grandfather. The majority of people who receive nursing home care in America or home care in America, which allows people to maintain dignity and respect in their amazing golden years, they rely on Medicaid to receive that assistance. And that, of course, is at risk of being ripped away from them. And Mr. McGovern, it's all being done in service of enacting the largest tax breaks for billionaires in American history. Billionaires like Elon Musk, who's the last person in this country who deserves a tax break.
And Mr. Aguilar, I support your amendment. You know, interesting enough, the House Agriculture Committee never did a hearing on the cost sharing issue with states. And there's a reason why governors all over the country are panicking that they may be hit with a bill of hundreds of millions of dollars or even $1 billion in the case of Pennsylvania, which they're not going to be able to meet. And therefore, it will result in them costing, it will end up cutting the benefit to people. And so I support it totally. And Leader Clark, let me ask you, is it possible at all for other providers like community health centers to absorb the patients that Planned Parenthood health centers see annually? And what services for women would be at risk?
Thank you so much for the question, and let's bust this myth once and for all, because we have two things going on here. We have the nearly 14 million Americans, including many women, seniors, moms, pregnant moms, who are going to be have their health care taken away from them totally, and that impacts healthcare centers, FQHCs. They receive, Medicaid is the single largest source of payments, reimbursements for our FQHCs. And this is what's always pointed to by the right, as they will just pick up these services for women out of this defunded clinics for Planned Parenthood. It is impossible at the same time that you are cutting Medicaid to these clinics. In Massachusetts alone, that'll be a almost $1.2 billion cut to these health centers, and saying if you're going to pick up what Planned Parenthood provides, you would have to increase the capacity of our FQHCs by 56%. So we're going to take away Medicaid over here, and then we're going to say magically increase capacity by 56% to serve the women who will no longer have a place to get the cancer screenings, the prenatal care, the fertility treatments, contraception, reproductive health care that they need, and that is increasingly difficult to find.
I regret that so much of what is done in this Congress and in this current administration around healthcare is so politically charged.
Yeah.
And again, going back to the SNAP issue, people are going to see their benefits cut. Again, on average of $2 a person, per meal. That's it. And if states can't meet their cost share, they have no choice but to cut the benefit, And no hearings on this, not one single hearing. And this is a major change. And not even the courtesy of a hearing. We weren't able to bring in governors or anybody from any states to be able to comment on what the impact of this would be, or whether even all the states could meet, their financial obligation. And I mean, that it's part of a reconciliation bill, and that nobody even cares enough to do a hearing on it. Is that the way you legislate around here? I don't know if you want to add anything before I yield back.
Thank you, Mr. McGovern. I think that's incredibly important, and I just share that the cost shared discussion really breaks a promise of 50 years of a relationship between the federal government and the states. This is shifting more resources so they can be the bad guys, and so they can reduce benefits, kick people off of eligibility. It's just an existential threat and would result in significant reductions in benefits to the people who need it most.
And I'll just say finally, all this does is it gives my Republican friends some cover to be able to dodge responsibility. And when benefits get cut, say, hey, it's not me, it's the states. And again, that to me is very cynical. I yield back my time.
Thank you, Mr. McGovern. Ms. Fishbach. Thank you. Ms. Scanlon, you're recognized.
Thank you. I think we just heard a little bit about myth busting. So Leader Jeffries, I was wondering if you could address the myth which we have had thrown at us repeatedly throughout all the committee hearings on this bill, that somehow these proposals are going to be paid for by kicking undocumented immigrants off federally subsidized food and health care. Is that true? Are undocumented immigrants getting federal health care and federal food benefits?
Yeah, it's a great question. Under current law, undocumented immigrants are already ineligible for Medicaid, the ACA exchanges, and for SNAP benefits. Not a single undocumented immigrant in this country gets a dime in federal taxpayer dollars for any part of comprehensive Medicaid coverage. Not one. And so when we're talking about nearly 14 million people who are going to be thrown off their health insurance, millions of others who are going to be jammed up by this aggressive cut to SNAP, the largest cut to food assistance in American history, we're talking about American children. We're talking about everyday Americans. We're talking about Americans with disabilities. And when it comes to nutritional assistance, we're talking about veterans who have served this country, sacrificed, risked it all. And they're going to lose access to the food assistance they need to live a life of dignity and respect. Those are the facts. That's why we're fighting hard to stop this GOP tax scam that will hurt everyday Americans dead in its tracks.
I appreciate that, because we've heard this gaslighting, for weeks now, and we knew it wasn't true, but I appreciate your clarifying that as well. And of course, to the extent that anyone was trying to game the system and get benefits to which they were not entitled, we have inspectors general who were tasked with rooting out fraud, waste, and abuse, but unfortunately have been fired by this administration. So, don't preach about wanting to ferret out fraud, waste, and abuse when you're pulling the watchdogs whose job it was. Thank you. I yield back.
Thank you, Mr. Scott. I've already came to you. Mr. Neguse, you're recognized.
Thank you. Thank you, Madam Chair. Thank you, Leader Jeffries, Whip Clark, and Chairman Aguilar for your leadership and for the amendments that you submitted before the committee today. As you all know, we started at 1 a.m., so this hearing's been going now for about 10 hours. We've heard from many Republican chairmen. We have, of course, many members of our caucus who are here that we'll hear from. The only person, and of course, we have all the leadership of the House Democratic Caucus, and we're so grateful that each of you came forward to testify in this fashion. The one person we haven't heard from is the speaker, who came here briefly earlier, but was not willing, I guess, to testify in the way that you all have. Mr. Leader, I know you offered to debate the speaker on the floor. I believe sent a letter to him about a month and a half ago on this particular reconciliation bill. And I wonder if you might expound a bit on why you think that is important for the American people to be able to hear that debate and that dialogue.
I thank the distinguished gentleman from the great state of Colorado. And first of all, let me thank all of the members of the Rules Committee, certainly my colleagues on the Democratic side who have done a tremendous job on behalf of the American people, Jim McGovern, Mary Gay Scanlon, you, Joe Neguse, and of course, Teresa Leger Fernandez. Let me also thank the Chairwoman Fox from the great state of North Carolina by way of New York City. She may have left the Bronx, but the boogie down Bronx has never left her. So thank you for providing this opportunity for us to have this discussion. But one person is missing, Speaker Mike Johnson. Over a month ago, I asked our distinguished colleague from Louisiana, the Speaker of the House, to debate any of us, but certainly myself, on the House floor about this very bill. He believes it's one big, beautiful bill. We believe it's one big, ugly bill. That's going to hurt the American people, hurt children, hurt families, hurt veterans, hurt seniors, cut health care, cut nutritional assistance, explode the debt by a minimum of $3.8 trillion. This is being done by people who claim to be the stewards of fiscal responsibility. $3.8 trillion, if not more. And so the offer still stands. I'd love to have the opportunity to debate Speaker Johnson anytime, any place, right here at the Rules Committee, or certainly on the floor of the House of Representatives. Not a duel, a debate of ideas.
I couldn't agree more, and I thank the leader, the whip, the chairman, and I yield back the balance of my time.
Thank you, Mr. Neguse. Ms. Leger Fernandez, you're recognized.
Thank you, Madam Chair, and thank you to each of you for coming and testifying. Rep. Clark, as you described the impact that the abortion bans have had on states across this country, the lack of reproductive health care in states around this country, and then that this bill would then add to that difficulty. I am reminded, and I've been sharing lately, a story that I didn't used to talk about because it was so hard, about how when I was pregnant, I almost bled to death. And I remember lying on that hospital surgery piece of metal. And they didn't put me to sleep because we were trying to save the baby. And they were screaming, we're going to lose her, we're going to lose her, we're going to lose her. Those doctors could concentrate on saving my life. They did not have to worry about whether they were going to be criminally charged or whether they were going to have to shut down their practice because they were working on a complicated pregnancy. And now we know across the country, in rural areas especially, we are losing our OBGYN care. So I want you to talk a little bit more about what happens in those rural areas, what happens in those areas where doctors are fleeing, and how what they're doing in this bill by going after Planned Parenthood, does that make it worse?
Thank you. Thank you for sharing that story. And it is the story of women across this country. Pregnancy is often complicated and it needs interventions. And we want safe outcomes. The way we get that is good prenatal care and being able to find that within a 50-mile drive from your home. And with the abortion bans, that is becoming out of reach for so many people. And it compounds the cruelty in this bill that is already there in all that they are taking away from women and children and families, from their health care, from food programs, public schools, the list goes on, for this cynical exercise of giving tax cuts to people who are too wealthy to need them or maybe even notice them. So we have to keep our eye focused on what is happening. And with this amendment, it may seem like a sort of insignificant or a very detailed part of this overall package, but the themes are the same. And at the end of the day, it is denial of health care for women in this country. And at the same time, we have a White House lamenting, why aren't women having children? Maybe we'll give them $5,000. If you don't have a safe place to have a child, if you cannot guarantee that you will survive, have the medical attention that you will need, and if you're able to have that child, that child will be able to access health care, that you'll be able to find affordable quality child care near where you go to work, that you will be able to have the fundamentals of a housing to be able to put a life together. A recent study showed the majority of families in this country, 60% of families cannot afford the basics. And what they're saying in this, and what makes it so pernicious, is this has no place in a reconciliation bill. This is ideology, and this is policy. And this is saying, we don't like abortion providers, and it's not enough to outlaw them in our own states, to deny that care in those states. If there is an affiliate or a subsidiary in any state, then we will shut down the clinic that is not providing abortion care, but is providing this critical primary care for women. That doesn't belong in this bill either. And it is part of the pattern and the theme of this bill, that the American family is put last, and we are making the winner's circle so very small. And it doesn't include women in this country. It doesn't include working families. It doesn't include seniors and veterans. And the 99.9% of people who get up and work hard every single day and want to have a future for their children, a place in this economy, want their small business to survive this tariff regime, want to be able to put a life together that has hope. And instead, we're offering them ideology wrapped up as healthcare. It is a cruelty, and it is a shame. And that is why we have seen the Democratic caucus and the American people united against this bill.
Thank you, Rep. Clark. Chairman Aguilar, your amendment, I think, touches on a very important fact, and that is that people are working, and they're working really hard, and they're often not getting paid enough. And when Democrats were in charge, we increased jobs. But right now, there is a recession looming. And what they're going to do is kick people out of Medicaid, and they're not going to be able to get nutrition programs. And they're saying it's because people are lazy. Is that right, Chairman Aguilar? I mean, what is really happening with regards to American families who are working hard and just maybe not making enough money?
Thank you. Thank you, Congresswoman, for sharing your story, first of all, and for the question. My amendment prevents what I hope is something we can all agree on. No child in our country should go hungry. Yet under this bill, nearly 645,000 people, including children ages 7 to 18, will lose some or all of their SNAP benefit just in my state of California. Whether you're a child in New Mexico or Maine or California, that isn't right. As cruel and failed as that 3-month time limit is, it has never been applied to parents and grandparents with dependent children. It's right in the name, able-bodied adults without dependents. So what is supposed to happen, the child turns 7 and now doesn't need to go to school by themselves. It's just playing wrong, and it puts kids at risk. No one is staying home for SNAP benefits that are $6 per person per day. If my colleagues were serious, we wouldn't be providing childcare and transportation and fair wages to help families make ends meet rather than cutting these important benefits.
Thank you, Chair Aguilar. And Leader Jeffries, thank you for painting the picture of what hunger looked like in America and what poverty looked like in America when we decided that that was not an acceptable picture for us. And I think it's a policy choice, but I think you also touched on a sense that it's also a moral choice. And I entered into the record earlier today a letter from 31 faith organizations who were opposing these kinds of cuts because they noted that it was against a principle, a moral principle that government should provide for those who are in need. And I just wanted to give you the last word. I'm the last Democrat who gets to ask a question on these issues of how you see the values and the choices that are being made in this bill.
Well, thank you again for sharing your powerful story in such a compelling way. And it really does illustrate the challenges that we confront here. When we make policy decisions, we are impacting the American people in ways that in certain cases could be questions of life and death. It's often been said, Dr. King made this observation, that budgets are moral documents. And I don't question anyone's faith in this room. There are people of faith on both sides of the aisle. But we do have to ask the question, can't simply be enough to go to synagogue or go to the mosque or go to church and pray on Sunday and then come to Washington, D.C. and pray on the American people the rest of the week. P-R-E-Y. Pray on the poor, pray on the sick, pray on the afflicted, pray on working families, pray on everyday Americans, pray on our children, pray on our veterans, pray on older Americans. It can't be sufficient to go to church and pray on Sunday, but then come to Washington, D.C., advance a bill like the GOP tax scam, and prey on the American people for the rest of the week. Democrats will never stand for it. And we're going to fight hard to make sure that we do everything we can to uplift the American people, to protect their health care, protect nutritional assistance, protect our veterans, protect our children, protect our women, our families, older Americans, and to protect the American way of life. I yield back.
Thank you, Leader. Thank you, Rep. Clark. Thank you, Chair Aguilar. I will say that, you know, as we did the procession on Palm Sunday, our Archbishop said exactly that he wanted to pray for all of us, that we would remember the poor and the needy, and that we would have the grace in our hearts to do what's right. Tribal leaders came and met with me yesterday and said that they had done the blessings in the morning so that they could bring them to Washington, D.C., because the cuts to Medicaid, the cuts to tribal sovereignty, the cuts was something their people could not survive. And so I think those prayers and those blessings are important so that when we come to Washington, we act from our hearts and that we let that lead our decisions. Thank you very much for all three of you for this incredible amendments, this incredible testimony. With that, Madam Chair, I yield back.
Thank you, Ms. Leisure Fernandez. Mr. Griffith, do you have any questions?
I do not. Thank you.
Thank you. Thank you all for coming. The witnesses are excused.
Thank you.
Madam Chair? Yeah, well,
I'm
well,
going to announce the names.
yeah, but before you do, can I make one statement? Brief. I want to thank all my colleagues who have been here for an incredibly long time. Some of them have been here since 1 o'clock in the morning. And I feel very proud to be part of this caucus. And I feel very proud of all the members who are here who want to make their voices and their views heard. And I especially want to also thank Speaker Emerita Nancy Pelosi for being here for hours as well. And I want to thank our leadership team. But it means a lot to me personally, and I think to everybody on this committee, that we have so many colleagues that feel so strongly that they have waited for hours and hours and hours to be able to present their amendments. And I thank you, Madam Chair, for letting me say that.
Okay, the next panel will be Tim Kennedy, Norma Torres, Al Green, Mr. Horsford, Ms. Beatty, Ms. Dingle, Mr. Gomez, and Ms. Robin Kelly.
Oh, yeah. The leader.
If you all would quickly get to the tables, please. We can fit in one more. One more. We can do one more. 2, 4. That's 7. Oh, yeah. May I suggest if you're here for the next panel, start down here and move up here. It makes it a lot easier to get people seated. Okay. Mr. Kennedy, you're recognized.
Thank you, Chairwoman Fox.
For 5 minutes.
Thank you, Chairwoman Fox, Ranking Member McGovern, and members of the committee. I'm here today to offer 2 critical amendments. First, to strike Section 44-111 and preserve the current 10% state cost share for Medicaid expansion, preventing the financial burden that will otherwise fall on states and safety net hospitals. Second, to strike Section 44-126, which targets and defunds community health centers that provide family planning services. Taken together, these provisions in the underlying bill, in addition to the massive cuts to Medicaid that this bill ensures, would decimate access to care for millions of Americans, particularly low-income women, children, and seniors. As members of the majority attempt to shove this bill down the throats of the American people, and frankly, some members of their own party, in a process that started in the middle of the night while America slept, my Democratic colleagues and I are here to stand up and shed light on what you're hoping to hide from the American people. As an occupational therapist myself, the husband of a physical therapist, the son of a nurse, and the representative of a community with 285,000 people who depend on these services, including 110,000 children Let me focus on what's at stake with the Medicaid provisions outlined in this bill. Since the passage of the Affordable Care Act in 2010, nearly 25 million Americans nationwide have gained access to care through the Medicaid expansion. That means moms have access to prenatal and postnatal care. Children can get regular checkups, and people struggling to put food on the table can still see a doctor before minor issues become emergencies. It means those in rural areas, often far from major hospitals, can visit clinics, access telehealth services, or get prescriptions filled without having to travel hours for basic preventative care. States that expanded Medicaid saw the uninsured rate among low-income adults decrease by more than half. It is so popular that even in states where the legislature and governor opposed it, like Oklahoma, when put to the voters, it was approved. In New York, the state I represent, expanding Medicaid has given over 1 million people access to care. With this bill, New York will face nearly $1 billion in new costs, while other states could see their expansions repealed entirely. As I've been here since the wee hours of the morning, participating in a broken process that started at 1 a.m., I cannot fathom why members of this majority would choose to rip life-saving care away from your own constituents in the name of tax breaks for billionaires, aside from the fact that the president told you to do so. As an occupational therapist, again, I've worked with patients, young and old, people who rely on Medicaid for necessary care. I've seen what happens when patients delay care because they cannot afford it. Minor conditions become chronic. Emergency room wait times lengthen, and hospitals cannot absorb the cost. As a result, our healthcare system becomes destabilized. In cutting Medicaid, we don't eliminate the need for care, we just eliminate access to care. And for those who aren't on Medicaid, we only make care more expensive and harder to get. We force families to choose between medicine and groceries. We push more patients into overcrowded ERs, and we risk lives. This Republican bill does not save money, and it sure doesn't help the people who sent us here to represent them. It shifts the burden to states, to hospitals, and to the people who can least afford it. Simply put, it's cruelty. My amendments protect Medicaid expansion programs and ensure that millions of Americans don't lose the care that they need, and that our public hospitals and safety net systems can continue to function. Without our Democratic amendments, this bill will make all Americans less safe and healthcare less accessible, particularly for our most vulnerable citizens. I urge my colleagues to support these amendments. Healthcare, we know, is not a luxury reserved for the few, and it shouldn't be. It is a right, and it is our responsibility to protect it. I yield back.
Thank you. Ms. Torres, you're recognized. You're a former member of the committee. We're glad to have you back.
Thank you. Good morning, Chairwoman, Ranking Member McGovern. It's great to be back with all of you here, although under difficult circumstances. I know how difficult it is to have to work through the night, but the work that we're doing here today is really important. It's important for members to be able to share how this bill will impact our constituents. The bill before the committee, it is truly a disaster for the American people. It would throw almost 14 million people off Medicaid. It would cause our hospitals to close in areas that need them the most. It would cut food assistance for more than 3 million Americans, and all to help the multi-billionaires that pay much less in taxes. I fully support many of the amendments proposed by Democrats to fix these cruel actions, and I hope that they'll be made in order. I have 3 amendments that would address problems in the bill and in the current policies of the Trump administration. First, I have submitted an amendment number 507, which would protect the health care of nearly 340,000 of my constituents by striking the hundreds of billions of Medicaid cuts contained in this bill. It's the common sense at this time when families are struggling with higher prices of food and good due to the self-inflicted wound of tariffs caused by our president. Second, I have an amendment to prevent the $300 billion in cuts to food assistance programs like SNAP. The Republican reconciliation bill would kick more than 3 million people off of food stamp assistance, again, while we are getting imported eggs from Turkey and other countries that are willing to help us in a time of need when our food prices are so high. Third, I have submitted an amendment to lift the SALT deduction cap imposed by the 2017 tax scam bill. The reality is that this simply shifts more federal taxes to Californians when California already contributes much more than many of your states. For example, California is a donor state. We send $692 billion to the federal government, and we receive back 609. That means we send $83 billion to many of your states to help fund the quality of life that all of you enjoy. Representative Griffin, Virginia they pay $107 billion. They receive more than in federal government that they give. Chip Roy of Texas gets back $71 billion more. Chairwoman Fox, North Carolina gets $53 billion more. Representative Norman of South Carolina, you receive $35 billion more. Representative Austin Scott of Georgia and Brian Jack of Georgia receives $35 billion more. And Representative Hutching of Indiana receives $30 billion more. So if we want to talk about welfare and welfare to the very poor, let's start with your states. Maybe your states should pay their fair share. Lastly, I have an amendment that would help stop the unlawful and dangerous firings of Federal Aviation Administration workers who maintain our air traffic control systems. They are the backbone of the air traffic control system. They are the unseen workers that help keep planes in the air and provide safe landings when we land. They support our air traffic controllers that ensure a safe flying public. While the administration is trying to recruit more air traffic controllers, they continue to fire probationary employees and reduce staffing for the people who maintain these systems. This is something that is critical that we need to address. Next and lastly, I have an amendment that would strike the 5% federal tax on remittance transfers in this bill. The tax proposal in this bill would disproportionately impact immigrant workers who already pay into a system that they cannot reclaim any of the Social Security or taxes, state, local taxes that they pay into. I'm sorry, lastly, I have an amendment that would disapprove of the U.S. Army Corps of Engineers work plan for fiscal year 2025. This plan isn't just flawed, it blatantly politicizes the project selection process in attempts to leave, once again, California, the state that all of you depend for welfare for your constituents, to have zero projects allocated by them. I think the American people should know what is in this bill. It's a tax giveaway to the filthy rich. Thank you, Chairwoman, for your patience, and I yield back to you.
Thank you, Ms. Torres. Mr. Green, you're recognized for 5 minutes.
Thank you, Madam Chair. Mr. Ranking Member, members all, I am here today because of SNAP and a concern. But first, I'd like to thank Ms. Mang, Grace Mang, for introducing the Fairness for Victims of SNAP Skimming Act. It has been reduced to Amendment number 30. I had a similar piece of legislation And this whole issue was called to my attention by a news reporter from Channel 2 KPRC in Houston, Texas. And as a result of his engagement, we produced a piece of legislation. I do not want to see block grants to Texas for health care. Madam Chair, Texas refused $100 billion to expand Medicaid. This is one of the reasons why Texas has the highest percentage of uninsured persons and the highest number of uninsured persons in the United States of America. I don't know that Texas is going to be responsible enough to accept the grants. What will you do and what will we do when Texas does what it does quite regularly, and that is decline federal dollars? So I'm here today to talk about a program that has benefited not only Texans, but persons across the length and breadth of the country. And this has been a bipartisan effort in the past. It was in existence until December of last year, right around Christmas. And it has to do with reimbursing persons who have their SNAP monies skimmed away with electronic devices such that they have to sometimes go without food. They are victims. We should not allow the
Al,
criminals.
would you suspend for just a minute? There's a knocking noise going on somewhere. Do you all hear that? And it's bothering everybody out there because I can see it on your faces. I don't know where it's coming from. It stopped. All right. Okay. It stopped. So I don't know what's causing it, but it was hard, making it hard to hear you and understand you. So I want to make sure we can hear you, and it's also distracting. So we'll start again. You didn't lose any time.
Thank you. I will elevate the level of my
Okay,
voice.
if you
if I
would
may.
speak up a little bit.
Thank you, I shall.
Thank you.
As I was indicating, this has been bipartisan. It has prevented criminals from causing persons to lose food. And I think that it should be bipartisan now in terms of reinstating this program such that people who need food and cannot afford the necessity of life will be able to acquire the food that they merit. I would also add this, that this program is one that has been sponsored by Republicans. So Republicans and Democrats should be able to agree to prevent criminals from taking food. Finally, this, there's been talk about work and how work is good, and I agree, work brings dignity. But the thing, Madam Chair, that hit a nerve with me was when our dear brother, whose name I cannot call because it's not appropriate to do so, but if I could call Mr. Norman's name, I would. This dear brother said that work built America, and he's right. It did. Over 10 million people working for more than 240 years without a paycheck. America is a great country, and it's great, Madam Chair, because of the economic foundational mothers and fathers whose lives were sacrificed. If you're in this country, you're standing on the backs of those persons who were enslaved. And you're right, work ought to be recognized. In this country, in our capital, in Emancipation Hall, the recognition for 240 years of enslavement is a plaque not much larger than that picture on the wall. That's an emancipation. It would seem to me that if we truly appreciate the dignity in work, then we would express that dignity for the people who had a hand in building the White House, a hand in building the Capitol, built the roads, the bridges, planted the seeds, harvested the crops, fed the nation. Why don't we recognize them to the same extent that we recognize people who are victims of the Holocaust? It just seems to me that if we're going to talk about work, let's talk about the people who built the country. And finally, I want to thank you for the time. And I'd like to thank the ranking member as well, and would hope that we can save this SNAP program. Thank you.
Good morning, Madam Chair, to the ranking member, to the Assistant Democratic Leader, to the members of the committee. I've been with you since 3 o'clock this morning. I want to thank you for your time, but I'm here to bring the voices of 750,000 people in Nevada who elected me to do a job, and that's to make sure their perspective is heard by this Congress and this committee. I know we've heard a lot, but I want to touch on what this bad-built bill for billionaires doesn't do, because it barely touches housing, a crisis that is affecting more than just the people in my district. My disappointment is with what is not in here. So once again, like I did in the Ways and Means Committee, I am here to let you and the American people know that there's nothing to address the fact that rent increases are outpacing people's income, that there's nothing in this bill that builds out housing for the middle class, that there's nothing in this bill that touches Trump's blanket tariffs, which are taxes that Americans pay, not some foreign governments, that will raise the cost of housing. In fact, in 2018, the CBO projected that the initial Trump tax cuts would reduce residential investment since their provisions are not favorable towards housing. That report proved true, as inflation-adjusted residential investment today is nowhere close to its pre-2018 trend. I'll also tell you what this bill does have. It has an annual tax cut for billionaires, over $255,000 a year, while the average benefit for working people earning less than $50,000 annually is a meager $265. The cutting of health care for 14 million Americans, and the selling of Nevada public lands without a single dollar going to the state for which those lands are intended. So let's recap. Trump is making borrowing more expensive. He's raising the cost of housing materials due to tariffs, and extending the GOP tax scam means continued reductions in residential investment and making Nevadans pay for it with our land. Please make it make sense. That's why I am offering a package of amendments to help our veterans, to address tipped workers, small businesses, and the hospitality sector, which has been hit hard by President Trump's tariffs. However, for the purposes of this hearing, I will focus my remarks around helping our veterans. My amendment seeks to address the housing crisis that my colleagues seem to be ignoring. This amendment would create a veterans housing fund through a 1% surtax on excessive corporate stock buybacks, limited to firms with over $10 billion in assets. We are asking that the largest companies, who recorded nearly $1 trillion in buybacks, pay 1%. Over 30,000 veterans are experiencing homelessness. If my colleagues are committed to helping veterans, then you can support this amendment to help balance that equation. This is not a blue city amendment. According to HUD's 2024 annual homelessness assessment report, nearly half of veterans experiencing homelessness are in suburban or rural communities. And my colleagues on the other side of the aisle in this committee represent 8 states that total around 6,000 veterans who are experiencing homelessness. Georgia, nearly 650. Virginia, around 400. New York, almost 1,200. Indiana, over 400. Texas, nearly 1,850. South Carolina, almost 400. Minnesota, 300. In North Carolina, nearly 700 veterans experiencing homelessness. There is nothing in this bill that addresses shelter, mental health, substance abuse, job training, and other assistance specifically for our veterans. So I'm urging my Republican colleagues to work with us now to fix this bill before it goes to the floor. We want to work with you to address the problems facing our constituents. Earlier this month, I introduced 3 bills that can help address the housing crisis. We need legislation that addresses the corporate takeover of single-family homes, like my Home Act. Not one Republican joined when I brought that bill forward. I introduced my Unlock Housing Act to address affordable housing by allowing the Bureau of Land Management to be able to lease the land to local governments and tribes specifically for affordable housing. This is a smart method to use the laws that already exist to build out more housing. Why? Because as Nevadans know, the land that we sell has not helped create the housing that we need. But we are seeing the same story over and over, that this bill does not have working people in mind. Instead, we have people like Representative Mark Amodei pushing to sell off more than 500,000 acres of land in Nevada under the guise of creating more affordable housing. He didn't even give a second thought to selling out our community. And for what? To use Nevada as a cash grab for the nation's debt? Don't believe me? Look at Section 8315 of the bill. If my colleagues are truly serious about addressing the struggles of the middle class, specifically housing affordability, then please support my amendments. I'm also putting on the record that I've sent a letter to Chairman Smith and to Speaker Johnson to bring up my TIPS Act to ensure that tip workers receive the benefits that they are entitled. Thank you, Madam Chair.
Thank you, Chairwoman Fox, Ranking Member McGovern, and members of the Rules Committee. I urge you to make in order my amendment, amendment number 280. This amendment is simple. It would stop the implementation of the Reconciliations Bill's massive cuts for the wealthy if the bill's other provisions result in reduction in funding of Medicaid, Social Security, or SNAP. Let me just put it in simple terms. It says no tax breaks for the wealthiest Americans if you cut the programs that everyday Americans, families, seniors, and others rely on. If you believe that is true, then you should have no problem supporting my amendment, which would make no changes if the bill does not cut Medicaid or food assistance. We are here to serve our constituents, and I know I'm not the only one here who has received thousands of letters and calls demanding that Congress protect health care, food assistance, and other critical programs. Constituents are saying, what are we doing? Well, I'm telling you, this panel shows you what Democrats are doing. We are fighting. And despite what the title of the Republican Budget Reconciliation Bill would have you believe, it is not one big, beautiful bill. It's a big billionaire's bankroll bill. And it is one of the biggest and most reckless and heartless attack on American families. It would rip away health care from almost 14 million Americans and 11 million children with food assistance. And the worst part of it is none of this is necessary. It is only being done to bankroll a billionaire's tax cut. That is why I am offering this amendment. I am offering this amendment for the 2.4 million Ohioans who rely on Medicaid to access critical healthcare services like blood pressure, diabetes screenings, mammograms, mental health services, and other life care situations. I am offering this amendment for the millions of women across the country who rely on Medicaid to cover birth of their child and to keep them and their babies healthy before and after birth. I am offering this amendment for the more than 42 Americans without federal food assistance that they might not eat tomorrow. I am offering this amendment for Anisha, an Ohioan, a constituent mother of 2, and a recent cancer survivor who relies on Medicaid. She's scheduled for surgery that Medicaid makes affordable. Her family also depends on SNAP to put healthy food on the table. Losing these benefits would be devastating. In short, I'm offering this amendment for Americans who are struggling to get by, who are counting on us, Democrats and Republicans, to lower their costs and to improve their lives, not enrich billionaires. Unfortunately, families I'm fighting for will not benefit from the tax cuts in this package. The top 0.1% of earners, billionaires, will see a tax break of some $278,000 per year. And that is a tax break of $762 per day, almost twice the weekly salary of someone making minimum wage in Ohio. It is clear that this bill is an attempt to sell out hardworking American families who are just trying to make ends meet to benefit the few. This bill would harm our constituents, Democrats' constituents, Republicans' constituents. Republicans have claimed that this bill does not cut benefits. And if you believe that is true, you should have no problem supporting my amendment, which would make no changes if the bill does not cut Medicaid and food assistance. So I would urge you to make this in order. And Madam Chair, I would like to enter into the records the GOP's budget plan, this article, the GOP's budget plan that makes it hard to conceal its lies about Medicaid and SNAP.
Without objection.
Thank you. Lastly, let me just say to the American people, we have been here all night, and we're here because of you. They planned this hearing at 1 a.m. in the morning to 5, and here we are now in the first panel at 11:45. Is this the way our country should run? Is this what you expect from our leaders? Let me answer it for you. The answer is no. And that's why we are here today. Thank you, Madam Chair, and I yield back.
You're recognized for 5 minutes.
Thank you, Madam Chair and Ranking Member McGovern, for letting us testify today about issues that matter to all of us and to the American people. Over the past several weeks, I've been very concerned about what this Republican reconciliation bill will do. Not only does this bill, the bill, if it's enacted, the House bill, would be the biggest loss of health care coverage in American history that will strip health care from almost 14 million Americans. But as my colleague just said, how many of the pieces of this legislation have been considered in the dark of night when the American people are not able to watch what is happening? It's been too many pieces of this legislation. I have offered several amendments. Medicaid is the largest payer of long-term care in America, which is why I filed an amendment to ensure Medicaid home and community-based services, or HCBS, are not cut or reduced as a result of this reconciliation bill. We know that the majority of seniors and individuals with disabilities would prefer to receive care in the comfort of their homes, in the communities that they've known, where they can maintain an independent life, remain engaged in their communities, and aged with dignity. And in fact, it is less expensive than in nursing homes, which is where most long-term care in America is paid for by Medicaid. Yet hundreds of thousands of Americans are already sitting on state wait lists to access home-based care. And this bill will exacerbate this issue. No one should have to sit for years on a waiting list to get the care that they deserve, and caregivers shouldn't live in poverty to do this critical work. Let's be honest. The long-term care health system in this country is broken. And until someone you've loved or you yourself are in it, you don't know how bad it is. And this system, this bill is going to break the system even more. I pray, I'm asking that my Republican colleagues change course on this misguided bill that would harm seniors and individuals living with disabilities. I'm also strongly supportive and am a co-sponsor of Representative Riley's amendment regarding President Trump's most favored nation executive order that was issued May 12th. In fact, I offered this exact amendment during the Energy and Commerce Committee markup last week. This amendment supports President Trump's executive order that aims to lower medication costs for Americans by preventing pharmaceutical manufacturers from charging Americans higher prices while giving discounts to other nations, when we, in fact, pay 2, 3, 4, 10 times as much as other countries do and spend more on the research for these drugs than any other country in the world. No one in America should have to pay higher prices for medications than patients in other countries, which I have to admit to you, was shocked that every single Republican on the Energy and Commerce Committee voted against this amendment that supports their own president's prescription drug pricing plan. And I have to say, I was very surprised after being up for all night when I watched President Trump Wednesday night say this provision was going to be in this bill. So I think there's some communication issues too. Simply doesn't make sense. Its logic is backwards and quite frankly absurd. And on top of this, we had a bipartisan deal that opened the door for a solution to lower drug costs for Americans last Congress. But thanks to Elon Musk, Republicans tanked that agreement and are now trying to pass a bill with no meaningful change that would not only fail to lower drug costs, but would also rip coverage away from 14 million Americans. I'm going to end by expressing my concerns with this legislation's impact on our environment and natural resources, which is why I filed 3 amendments that I offered during the natural resources markup 2 weeks ago. Taken together, these amendments would preserve judicial review. I think too many people forget we are a system of checks and balances in this democracy. Protect compliance with the Endangered Species Act, which has literally saved thousands of species, and prevent the Inflation Reduction Act decisions from NOAA from applying to fisheries, climate resilience, and harmful algae bloom forecasted in the Great Lakes. I'm getting that look, so thank you, Mr. Chairman, and I yield back.
I thank the gentlelady. She yields back, and I recognize Mr. Gomez of California for 5 minutes.
Republicans are playing Russian roulette with the American people. That's right, I said it, Russian roulette. And that's because either you're going to lose your health care, that could probably save your life, or not. You can get a tax increase or not. This is serious business. According to the Joint Committee on Taxation, Congress's nonpartisan scorekeeper says families making $30,000 or less will pay an average of $200 billion more in taxes because of this bill. Families making $50,000 a year, you have a 50-50 chance of seeing a real change in your taxes. But you'll have to wait till April to see how lucky you were. Now the billionaire establishment has nothing to worry about. They'll get a tax cut of $270,000 a year. Right here in this committee, the American people are witnessing one of the biggest transfers of wealth in American history. But Republicans are advancing legislation that will slash billions of dollars from Medicaid, healthcare for the working class, so that they can give trillions in tax breaks to the billionaires, ultra wealthy, and the largest corporations in this country. Republicans are literally stealing from the poor to give to the rich, all while adding trillions in deficit deficit spending and to the debt. They should be ashamed about this legislation, because look at not what's happening in my district, look at what's happening in their districts. In North Carolina, 400,000 people will lose Medicaid coverage. In Minnesota, 250,000 will lose the health care. Texas, 380,000. Virginia, 390,000. New York, 1.2 million. These aren't numbers. These are real people who will lose healthcare coverage. And if they don't have coverage, they might not have insulin. They might not have preventative care. They might have to go into the hospital to see an emergency doctor later, which can cost them their lives. We also know that 51% of new moms and their babies who are covered by Medicaid will lose. The seniors that don't get enough coverage through Medicare will lose. The sons or daughters that don't earn enough to cover their parents' assisted living facility will lose. People that live in rural communities that are mostly represented by Republicans will lose. Republicans are making it harder for working people to get by, harder for families to welcome a new child, get postpartum care, or cover basic medical needs during one of the most vulnerable times in their lives. Families are barely staying afloat. Many who are working 2 or more jobs just to get by, and they're already stretched thin by the cost of food, housing, and childcare. Now that Trump's tariffs are hitting them with an extra $4,900 a year. And Republicans always say that they're the pro-family party, but they never do actually anything that actually values the American family. And Republicans say they're the balanced budget party, but this bill balloons the deficit and saddles future generations with more debt that they have to pay off. Voters sent us here to lower costs and create real opportunities, and that's what we should be delivering on. We should make the child tax credit fully refundable and advanceable, and make it bigger and pay it monthly. We should build millions of starter homes for new families and help them buy their first home so that they can build wealth. We should make childcare affordable and guaranteed paid family leave. But this bill does none of that. That's because Republicans choose the billionaire establishment that has taken root in DC over their own constituents. Now I ask the same question to my Republican colleagues as I asked in the Ways and Means. I want to ask you here, and they answered wrong. So I'm asking you guys, are you for the working man or woman who is struggling to get by, or the billionaires? Are you for the babies or the billionaires? Are you for the seniors or the billionaires? Are you for the American family or the billionaires? I have introduced 14 amendments making sure that billionaires pay their fair share to housing, to healthcare, and one of those bills is sponsored by Speaker Emerita, that is extend the ACA premium tax credit to help pregnant women and children. That's one of the things that we know, that in some of the states that are going to have the biggest cuts to Medicaid also are some of these southern states that have the highest maternal mortality rate in the country. You know, California has its problems, but we actually have one of the lowest maternal mortality rates in this country, the lowest. So here's the thing. Once again, are you for pregnant women or the billionaires? Are you for babies or billionaires? Because that's what this all comes down to. And I will ask that if you vote on just one amendment, maybe you can restore a little faith in this kid from California. With that, I yield back.
Gentleman yields back. Now recognize Ms. Kelly of Illinois.
Thank you, Mr. Chair, and thank you, Ranking Member. I have an amendment at the desk titled Amendment Number 371. My amendment is simple and requires 12 months of continuous Medicaid and CHIP coverage of full benefits for pregnant and postpartum women. We've heard a lot about that. I've dedicated 10 years to this topic. This amendment will codify what we already know is essential, that 1 year of postpartum care is not just medically necessary, it is a matter of life and death. Let's remember that the United States maternal death rate remains far higher than other high-income countries, and nearly 2 out of 3 maternal deaths occur during the postpartum period. Our nation is facing a maternal health crisis, and it has been for years. It's shameful, and it has worsened. The maternal mortality and morbidity epidemic is particularly dangerous for people with disabilities who face a maternal death rate that is 11 times higher than the rate for non-disabled people. Black women are 3 times more likely to die from pregnancy-related causes than white women. And American Indian and Alaska Native women are twice as likely to die of complications. Medicaid improves maternal health outcomes and ensures access to vital pregnancy services. Medicaid covers almost half of all births in this country, and in many states, it's more than that. And it covers more than half of all births in rural communities. Consider a new mom from Arkansas who was finally approved for Medicaid in her 3rd trimester following a delay in her eligibility determination. Her Medicaid coverage was invaluable during complicated labor and delivery. Her baby was not receiving enough oxygen, and she ultimately needed an unplanned cesarean section. Without Medicaid, that procedure would have resulted in profound medical debt, giving the cost of a C-section in Arkansas is estimated to be close to $10,000 without insurance. Ensuring 12-month coverage can give women the peace of mind that they have stable coverage and access. Cutting funding means cutting care for moms and babies during their most vulnerable time. That means fewer prenatal checkups, more life-saving deliveries, and forcing states to choose between vital programs. Waivers aren't enough, especially during major budget cuts like those in this bill. In Michigan, 12-month postpartum Medicaid coverage reached nearly 45,000 moms, reducing maternal deaths from 36 to 22 per 100,000 births in a year. Most maternal deaths occur after childbirth. 1 in 3 happens 1 week and 1 year postpartum, between 1 week and 1 year postpartum. In Colorado, 89% of maternal deaths were preventable. Continuous guaranteed year-long coverage saved lives. Overall, over 80% of maternal deaths are preventable. This amendment codifies 12 months of full Medicaid and CHIP benefits to postpartum individuals, no more state-by-state patchwork, no more expiration dates on care, no more new mothers being dropped from coverage just 60 days after giving birth, right when they're still at high risk for complications like infection, postpartum depression, and more. Postpartum coverage for 12 months should be mandatory and permanent and immune from shifting state politics and budget pressures. We cannot expect someone to recover from childbirth, return to work, care for a newborn while also scrambling to reapply for coverage. That's not health care. It's chaos and disproportionately harms low-income families, rural communities, and communities of color. We've already seen the impact of this policy. Thanks to the American Rescue Plan, Democrats enabled states to extend postpartum coverage to 12 months, and 49 states have done so. In just 4 years, red and blue states alike chose to prioritize maternal and child health, but making it optional isn't enough. With the deep cuts proposed in this bill, states will soon face painful budget choices that could jeopardize this progress. To protect moms and babies everywhere, we must make this coverage permanent, mandatory, and nationwide. This is about saving lives, supporting families, and finally treating maternal health as a national priority it should be. I have deep concerns states will roll back care for pregnant and postpartum women. My amendment ensures that all women in the United States, regardless of where they live, can access comprehensive health care for a full year following the birth of a child to survive and thrive. I've spoken to doctors, nurses, midwives, doulas, and this is what all of them recommend. If Republicans claim, quote unquote, they want to strengthen Medicaid for mothers, as they asserted in their press releases, then this should be a no-brainer and something that we all can support. I urge my colleagues to support this amendment and help us build a stronger, safer future for all moms and families so that people are not being shut out from coverage because we have made it too complicated for them. And I yield back.
Gentlelady yields back. Do I have anyone on the Republican side that wishes to ask questions? Seeing none, recognize the gentleman.
Yes.
Mr. McGovern.
Well, thank you. I just a couple of observations. First of all, I want to again thank you all for your commitment and your stamina and for being here. Again, I appreciate the fact that many of you waited many, many hours to be able to testify, but I think that's a reflection of how strongly you feel about the issues that you brought before this committee. And I think I speak for all the Democrats here. We all support your amendments, and we'll do our best to try to see what we can do to make them in order. But I also, when I was listening to everybody here, I couldn't help but think about what could have been. You know, again, as I said before, I mean, there are things in the tax bill that I think we all could agree on. You know, the middle class tax cuts, the no tax on tips, and child tax credit, all that stuff. We could have come together and agreed on that. And I think that you know, we would have you know, if Republicans wanted our vote, we could have negotiated a better deal on the SNAP benefits, which right now is unacceptable, and certainly insisted that people don't get thrown off health care. But I think you could have gotten a bipartisan bill. Maybe not every Democrat and not every Republican, but you could have gotten a bipartisan bill that might have been able to make its way to the president's desk that reflected our values, also reflected some of the Republican values, but didn't go after the most vulnerable people in this country. But I think what's happened here in this House right now is that the way the current leadership thinks of legislating is that whatever the most extreme element of their conference wants, that's the direction. And so there's no desire, there's no attempt to try to bring Democrats into the process. I'm reading, a breaking news. Speaker Johnson and House Freedom Caucus will go to White House today to meet with President Trump. Trump is expected to tell the House Freedom Caucus that the bill needs to pass today. I don't even know, he was up here yesterday morning. I don't know, maybe this will make a difference. But it doesn't sound like, if that's the strategy, that this bill is going to moderate. And I think that's bad for the country. This is a big deal. The implications of this Reconciliation Act on every aspect that was raised by all of you today is significant. It is going to adversely impact, it is going to hurt our constituents, as well as the constituents of our Republican colleagues. There is no doubt about that. And so again, I want to again thank you for being here, and again, I support all your amendments, and for what it's worth, and I think I speak for all of us up here, it's kind of inspiring for us to see you just kind of wait it out, because you know what the stakes are, and I think people who are tuning in also appreciate your being here today. So I thank you, and I yield back to the chairman.
Gentleman yields back. I recognize Ms. Scanlon for.
Thank you. I
fabulous question.
want to echo the ranking member's remarks. I think the outpouring of members here is inspirational and is a measure of just how significant and impactful this bill is going to be in a negative way. And you've all raised important policy issues that deserve full legislative consideration. And also, the American people deserve to know where their representatives stand on these issues. So I would support a full vote on them. I did with respect to Representative Kelly's bill. This has been a major issue in my district, and I just wanted, in support of that bill, to seek unanimous consent to enter a Philadelphia Inquirer article from September 21st, 2022, entitled 80% of pregnancy-related deaths are preventable, CDC says, highlighting a problem in Philadelphia.
Without
Yield back.
objection,
Thank
so
you.
ordered.
Yield back.
Gentlelady yields back. Now recognize Mr. Neguse for his 5 minutes.
I thank the chairman. Well, first, let me just say thank you to my colleagues and echo the sentiments from our ranking member and Ms. Scanlon, our deep appreciation. And it's not lost on us that there are several of our colleagues here, Mr. Chairman, who testified just a few short minutes ago, who spent more time in this hearing than Republican colleagues of ours on this committee. There are several members. No, I'm not referencing the chairman, but others of your colleagues. Mr. Horsford has been here literally since we arrived and convened, and we have members who, as has Mr. Kennedy, I'll go down the whole list, but every member here has been here for literally going on 7, 8, 9, 10 hours for 5 minutes, to be able to speak for 5 minutes on behalf of the people that they represent. And I think that's a testament to their convictions and their passions for their constituencies. I want to ask just a few questions of Mr. Horsford and Mr. Gomez as the two members who serve on Ways and Means. Mr. Horsford, you heard me earlier, if you might, maybe at 4 in the morning or 3 in the morning, I don't remember exactly when, in my exchange with the chairman of the Ways and Means Committee regarding the tax on tips. And I'm still trying to understand why the Republicans on the committee don't just put your bill on the floor, given that there's bipartisan support for it, given that this seems to be an issue that they're passionate about. I struggle to understand why that's not the case. And I know you have fought vigorously on behalf of the people that you represent in Nevada for that particular policy, but I want to give you an opportunity to expound upon it if you're interested.
Thank you to the Assistant Democratic Leader. Look, to be clear, I've been working with a coalition of workers, the culinary workers, Unite Here, One Fair Wage, and others to bring legislation to provide relief to tip workers. 6 million tip workers in America today make as little as $2.13 an hour. $2.13. 70% of those workers are women, and women of color in particular. So on top of giving relief and allowing more tip workers to keep their hard-earned money by eliminating the tax on tips, we also need to give workers a raise. And that is what my bill does. No other bill does that. My bill also has important safeguards so that people continue to pay into Social Security, so that hedge funds are not able to grift off of the policy, so that we define what a tip worker is, so that it's not abused under our tax law. And so for Chairman Smith to sit here today and say, you know, he couldn't bring a bill to the committee is just wrong, because I'm ready. I've been ready, and my bill has been ready since the beginning of this Congress. And it comes from the actual tip workers who are affected by the policy. I am a co-sponsor of the bill that was unanimously passed by the Senate, the same version. And I see no reason why the House cannot bring up a standalone bill to make sure that we are advocating for the needs of tip workers and all workers. You're going to have all these compounding effects of cutting health care, of cutting nutrition programs, of making it harder for working families to get by. Then let's give workers a raise. Let's give them a raise that's livable enough to actually pay the rent on and to afford to buy a home. That is what Democrats stand for. That's what we're fighting for, is to give everyone an opportunity to not just survive, but to actually thrive in America. So thank you to the Assistant Leader for the opportunity to talk about that legislation. And Chairman Smith, wherever you are, my letter to you asking for a standalone vote on my legislation is at your office.
Well said. Well said. Mr. Gomez, there was a robust discussion earlier about the tax brackets.
Yeah.
And I think the chairman was not as candid as I would have hoped with respect to his description of the various tax brackets in the reconciliation bill. I wonder if you might talk about the billionaire tax bracket and the amendment that you proposed.
Yeah, first, I have an amendment that would increase taxes on billionaires, basically preventing them from getting any kind of tax break in this bill and actually require them to pay their fair share, increasing the tax bracket from 36% to 39% roughly. So in this room, by show of hands, who believes a billionaire shouldn't get a tax break and actually should pay their fair share of taxes? Like, all right, how about on the Republicans? You guys can help me restore my faith. Because here's the thing.
There aren't many Republicans here on the committee,
but
unfortunately.
here's
They're
the thing.
They've all left. But
And the reason why is that if you increase the taxes on the billionaires, you can actually give the people who are getting screwed at the bottom rungs of the economic ladder a tax break. So for the record, I want to enter into the record the distribution chart, distribution of the estimated revenue effects of the tax provisions of the chairman's markup, basically what's going to happen into the record. This is by the Joint Committee on Taxation. It's an official record.
What's it on?
It basically shows how much, who's paying what in taxes under this bill by the Joint Committee on Taxation.
Without objection, so ordered.
Thank you. And here's the thing, the reason why, let's go over years, calendar year 2027. If you're people that make less than $15,000 a year will pay an additional $1 billion in taxes, $1 billion. And here's the thing, in the year 2029, people that are making less than 15 million are going to pay 15,000 will pay another $2.6 billion in taxes that year. People that are making 15 to 30,000, 2.5 billion in additional taxes that year. And we go on to year 2031. They're actually less than 15,000. They're going to pay another $3.6 billion that tax year, 3.6 billion. And if you're making 15 to 30,000, you're going to be, all those people will be ponying up another $4.5 billion, $4.5 billion. And by the year 2033, let people that are in that tax bracket of less than 15,000, $3.7 billion just that year. And then the people making 15 to 30,000, 3.8 billion. So anybody that says that the people at those low rungs of the economic ladder are not getting screwed or not going to be paying more in taxes are just absolutely wrong. And with that, I yield back to Mr. Nagus.
Thank you, Mr. Gomez. I yield back now.
I did.
Chairman yields back. Seeing anyone else wishing, seeing no one else wishing to ask questions, I thank this group for presenting your amendments. Thank you for being with us, and we will move on to the next group, and I'll need the names. All right, as they're leaving, our next panel will be Ms. Dexter, Mr. Carter, Ms. Takuda, Ms. Bonamici, Ms. Barragan, Mr. Tonko, Ms. Goodlander, and Ms. Stansberry. All right, if Ms. McLean Delaney could join as well. And now recognize Ms. Dexter of Oregon for her 5 minutes presentation.
Thank you, Mr. Chair, and thank you to our ranking member. Today, I'm offering 3 amendments rooted in a basic principle. Government should work for the people, not silence them, not shield corruption, and certainly not rip away healthcare. Let's start with what this GOP tax scam tries to take from the public, their voice. Under current law, communities can protest oil and gas leasing decisions that threaten their land, water, or climate. This bill would impose a $150 fee, plus more for extra pages or lease parcels, just to be heard. And let's be honest about what that is. A tax on public participation, a toll on free speech. And it won't deter billion-dollar oil companies. It will deter working people, people who love outdoor places. At the same time, Republicans are slashing royalty payments and handing billions in giveaway to the fossil fuel industry. That tells you everything you need to know about where their priorities lie. My amendment would strike this unjust protest fee from the bill and protect the public's right to be heard. Second, we must ensure accountability. I'm offering an amendment to allocate a modest 0.5% of new funds to the Department of Interior's Office of the Inspector General, a nonpartisan watchdog that saves taxpayers' money by rooting out waste, fraud, and abuse. This should be easy for Republicans to support. It's the same bipartisan provision they themselves championed by our current House Natural Resources Chair in 2021. It's simple. Let's ensure transparency and pass this amendment. And now I want to speak to what I believe is the most urgent and dangerous part of this legislation, its impact on healthcare. Before I came to Congress, I spent nearly 20 years caring for some of the sickest patients in our community. I've worked in emergency rooms. I know what happens when a system doesn't have the resources that it needs to serve its patients. That's why I'm offering an amendment to require states to report on how coverage losses under this bill would impact uncompensated care and emergency department wait times in safety net hospitals. If this bill were really only about ridding out waste, fraud, and abuse in Medicaid, we should welcome this kind of data. But we know the truth. This bill isn't about waste. It's about ripping healthcare away from nearly 14 million Americans and destabilizing the healthcare system for everyone else in the process. And for what? To give tax breaks to billionaires. Medicaid isn't just a lifeline for patients, it's a fundamental part of our healthcare infrastructure. Providers depend on it to stay open, to serve not only Medicaid patients, but you, me, everyone in our communities. Cutting Medicaid will mean clinics and hospitals in rural towns will shut down. Hospitals in cities will be over capacity. Seniors will be forced out of nursing facilities due to closures. And emergency rooms will go on divert, turning away people in crisis because there simply isn't enough space for people to be seen. We're talking about longer wait times for pediatric care, delays for life-saving cancer treatment, people suffering and dying, not because we don't have the tools to help them, but because we've made a political choice to take those tools away. These cuts will be devastating, and the consequences won't be statistics on a spreadsheet. They will be lives lost, futures cut short, and suffering that could have been prevented. And again, for what? Tax breaks for billionaires. I urge my Republican colleagues, show courage in this moment. Stand with the constituents who cannot afford to lose their voice and their health care. Support these amendments and defeat this outrageous and dangerous bill. Thank you, Mr. Chair. I yield back.
Gentlelady yields back. Now recognize the gentleman from Louisiana for 5 minutes, Mr. Carter.
Well, okay. Okay. Let's start again. Thank you, Mr. Chairman. Thank you, Mr. Chairman and Ranking Member. My first amendment, number 299, preserves environmental justice block grants that improve public health. The EPA has provided grants for more than 50 years that protect our constituents' public health and enhance their environment. This is especially true for the Environmental and Climate Justice Block Grant Program, which provides valuable funding that serves community centers, environmental rehabilitation projects, and public health revitalization initiatives that would otherwise not be possible. These projects are providing environmental and public health benefits in Democratic and Republican districts alike. However, this bipartisan bill ruthlessly claws back these funds and eliminates this vital program. Not only is this bill stealing people's health care, it's also making them sicker. My amendment will ensure that environmental and climate justice block grant projects that improve the health outcomes in low-income communities do not lose critical funding. If Republicans truly prioritize their constituents, they should easily agree with me that this funding is valuable and must be protected. My second amendment is amendment number 358, which would add to the text the bipartisan Next Generation 911 Act to the Republican budget reconciliation legislation before us today and fully fund programs using the proceeds from future spectrum auctions. Because of technology advances, the telecommunications over from the past 50 years, Americans can communicate today in ways weren't even contemplated when 911 system was first created. Yet, our 911 systems are stuck in the past. Our first responders are unable to utilize these tools we take for granted in this digital age. we are far behind. Police officers, firefighters, and emergency medical technicians who serve communities we represent deserve better. I cannot think of a better use of dollars raised from auctioning off public airwaves than to upgrade old, outdated public safety communication systems. I hope my colleagues will vote yes on this amendment to modernize our 911 systems for the 21st century. Congress should give FCC the authority to begin spectrum auctions now. Those proceeds need to help our constituents and first responders not pay for tax cuts for the ultra rich. My third amendment is Amendment 373, which states no funds can be used to effectuate the detention or removal of United States of citizens of the United States or any non-citizen whose legal status was determined or visa revoked due to exercising simply their right to speech, free speech, not breaking any laws, simply their right to free speech. Last month, I led a delegation of House and Senate members to 2 ICE processing centers in Louisiana to meet with individuals who had their legal status revoked and remain in immigration detention simply because they exercised their right to free speech. If these individuals can be jailed for exercising their First Amendment rights, any person in this country is under the same threat. Now, let me be clear. I do not support any hate speech of any kind. Speech that supports anti-Semitism or calls for violence, I am totally opposed to. The individuals we met with were very clear. They don't support these matters either. My fourth amendment and last amendment is number 357, which states that 100% of Medicaid cuts resulting from waste, fraud, and abuse will go directly back into programs to strengthen Medicaid for generations to come. My Republican friends say that they want to help the people that Medicaid was quote unquote intended for, the most vulnerable. And to that I say, put your money where your mouth is. But we all know they won't. It's always been about enriching billionaires while ripping health care away from seniors, children, mothers, and those with disabilities. Republicans now say that Medicaid shameful. We will put the most vulnerable at risk. That's why we keep spinning false narratives about waste, fraud, and abuse. But don't take my word for it. Take it from Republican Senator Josh Hawley, and I quote, will Republicans be the majority of the people or a permanent minority speaking only for C-suite? So if the goal is to protect Medicaid and root out waste, fraud, and abuse, we should have no opposition to support my amendment to reinvesting these funds into Medicaid. I have one final quote, ma'am, and I know I'm shortly over, but I want to remind people. I'm told yesterday that our president, Donald Trump, said, and I quote, please forgive my language, don't fuck with Medicaid. I hope he was serious, and I hope this committee takes it serious too. I yield.
Carter, Mr. Kuda, you're recognized for 5 minutes.
Thank you, Madam Chair. Ranking Member McGovern, I submit one amendment today, 159, protecting rural Americans from SNAP cuts. Every day, millions of Americans go to bed hungry. For 14 straight years, the United States has led the developed world in food insecurity. In 2023, over 1 in 4 Americans reported struggling to afford food. Think about that. In the richest nation on earth, 85 million people are missing meals. And where is this pain felt most deeply? Rural America, small towns, farming communities, places like Hawaii's 2nd District, where food is grown, but life is hard. 87% of the counties with the highest food insecurity are rural. Families face fewer job opportunities, fewer doctors, fewer grocery stores, and now even fewer lifelines. And Republicans want to make it worse. This isn't just a bad bill. It's a big bad bill. It's a big ugly bill, a brutal assault on rural families, working parents, seniors, kids. The GOP plan is to slash $313 billion from SNAP, gut Medicaid, rip lifelines out of the hands of people just trying to survive, and hand billions in tax breaks to the ultra wealthy. All this as part of the GOP tax scam 2.0, a reckless giveaway to billionaires that will add $5 trillion to our national debt. $5 trillion in tax breaks for the rich, paid for by taking food off tables and putting healthcare out of reach for working Americans. This isn't fiscal policy. It's moral failure. It's the wealthiest 10% cashing in at the expense of the poorest, most vulnerable, hardworking people who labor every day to hold on to life in communities too often forgotten. Let me tell you about Anna, a constituent of mine from the rural west side of Oahu. She and her husband run a small family business. Last year, just $200 more in monthly sales pushed them over the limit for SNAP. $200. That tiny increase cost their children meals. Anna told me she had to measure every scoop of rice at dinner. She couldn't say yes when her youngest child asked for a second helping of food. She sent her kids to school hungry. Months later, after their sales dropped again, Anna reapplied. They were approved, and she cried. But now Anna and her husband wonder every day, should we sell our home? Should we leave our community? That's the America we're creating, where a family's survival depends on a spreadsheet and, sadly, declining sales. Anna isn't a cheat. She isn't lazy. She's not gaming the system. She is the system, the engine and the heart of rural America, working, sacrificing, raising kids, building a future, and yet this bill punishes her. SNAP works. It feeds families and fuels local economies. Every SNAP dollar we know generates over $1.50 in economic activity. It supports farmers, grocers, small town businesses. It breaks cycles of poverty, and Medicaid keeps rural hospitals open, keeps parents and kids healthy. It keeps people alive. Cutting these programs isn't just cruel, it's anti-American. But here's the truth. The cruelty is the point, because this bill is about priorities. The GOP's priorities is clear. Cater to the billionaires, crush the working families, and let's call it policy. They're ready to hand out massive tax breaks to the wealthiest Americans while robbing the rest of the country of food and care. That's not a budget. That's a betrayal. So yes, this bill will devastate rural America. It will mean more hunger, more closed clinics, more families like Anna's forced to consider giving up their homes, their communities, their dignity, so that billionaires can buy a third yacht and pay even less in taxes. But we have a choice. We can do the right thing. We can stand with the families who work hard and ask only for a fair shot. We can vote for policies that invest in people, not punish them. We can reject the GOP tax scam. We can protect SNAP. We can defend Medicaid. And we can refuse to balance budgets on the backs of people who can least afford it. This amendment is our choice. If you are confident rural America will not see SNAP cuts or decreased benefits, as the chair of the Agriculture Committee has claimed, then this amendment will do no harm. Vote yes. But if you have a concern, and quite frankly, a conscience, vote yes. Reject this big bad bill. Thank you, Madam Chair, and I yield back.
Ms. Bonamici, you're recognized for 5 minutes.
Thank you, Madam Chair. My amendment, which is number 24, is pro-family, pro-children, and pro-mom. It guarantees that this bill will not take away nutrition benefits for moms and hungry kids in the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC. Federal nutrition programs like WIC and SNAP and school meals are investments in the health, learning, and development of children and young adults and communities across the country, and are some of the most successful tools we have for reducing child hunger. These nutrition programs have been associated with improved educational outcomes and reduced food insecurity, which is especially important for children from low income and food insecure families. And it's widely known that WIC contributes to healthier births, nutritious diets, and improved infant feeding practices, better healthcare for children, and higher academic achievement. The benefits are indisputable. So WIC has served as a lifeline for many mothers and their young children, and I urge my colleagues to support my amendment. I would now like to make a few comments on amendments that I am either co-sponsoring or supporting. There is one by Ranking Member Bobby Scott to protect American children from going hungry with regard to the proposed cuts to SNAP. Yesterday, the Urban Institute released a new report highlighting that as many as 18.3 million children could lose access to free school meals as a result of the harmful provisions in this bill. And we know that every congressional district has children who are hungry. Families are working hard, but the income isn't keeping up with the cost. So I hope we can adopt Mr. Scott's amendment number 184. I also want to speak in support of a amendment that is going to be introduced or has been introduced by Representative Sykes to strike the language in the bill that cuts Medicaid. In Oregon, 1 in 3 people are covered by Medicaid, including 57% of Oregon children. And make no mistake, if you rip away healthcare from millions of Americans, people will die. Rural hospitals will close, cancer patients will go without treatment, and I will support this amendment and proud to support this amendment. I also want to raise an issue in the amendment that is introduced by Representative Rivas, number 215. This is an amendment that will fix a catastrophic policy that's tucked quietly into this bill that would let the world's most powerful technology go unchecked for the next decade. This is a blank check for big tech. It would, and the bill as written will block state and local governments from regulating artificial intelligence for 10 years. That is a long time. That is a decade of risk. Let's be clear, we do not have federal policies or governance laws on data privacy, security, and bias. And I served on the bipartisan House AI task force, and we spent a long time studying these issues. And our report that was signed by both Republicans and Democrats explicitly warns against blanket and impulsive federal preemption of state AI policy. And I quote, without comprehensive federal AI or data privacy laws, states are well positioned to address gaps, tailor protections, and respond to emerging harms. But this bill ignores that bipartisan advice. Yesterday, 40 state attorneys general, including Oregon's Dan Rayfield, sent a bipartisan letter opposing this provision because of the unchecked harm it will cause. And let's talk about what that could look like. An algorithm that denies a disabled person access to housing and no state agency could intervene. A company that designs generative AI to imitate voices or faces without consent. States couldn't stop it. A hiring platform that discriminates by race or gender. Under this bill, if a company deliberately designs an algorithm that causes foreseeable harm, they'd be legally unaccountable, and it would leave policymakers and the public flying blind as a handful of corporations consolidate power over rapidly advancing technology. And I'm not talking about machines. I'm talking about civil rights, consumer safety, child protection, elections, employment, and more. The House AI Task Force made it clear we should empower good AI policy at the state level, not block it. This amendment strikes the provision and gets government out of the way so states can protect their people. Let's test whether Congress stands with the public or with the powerful. I also have a few bills I want to mention that, or excuse me, a few amendments that I'm co-sponsoring. One by Mr. Byer to keep energy costs low by taking 2 of the most successful energy policies in history, the production tax credit and the investment tax credit, protecting those. Also, Mr. Byer's amendment protecting bipartisan clean energy tax credits. I also want to support, be on record as supporting Ranking Member Bobby Scott's amendment number 261 that makes it harder for students, strikes the language that makes it harder for students to access high quality education. And one more, Madam Chair, with your indulgence, I want to support the amendment by my Oregon colleague, Representative Bynum, that ensures the Consumer Financial Protection Bureau retains current funding for protecting student borrowers. And I yield back.
Thank you, Ms. Bonamici. The order now is Goodlander, Stansberry, Delaney, and Tlaib. Okay, Goodlander.
Thank you, Madam Chair, and thank you, Ranking Member McGovern, for the opportunity to be here today on behalf of the people of New Hampshire's 2nd District to offer a common sense, one-sentence amendment to this truly big and catastrophically bad bill. We know the bill is big. I brought a copy with me. It doesn't fit on this very big table in front of me. This bill is catastrophically bad because of what it does and what it fails to do, and that's where my amendment comes in. This bill is catastrophically bad because we know what it's going to do to 14 million Americans who will lose health coverage. The biggest cuts to healthcare in American history. It's going to hurt our kids, people with disabilities, pregnant women, seniors. It's going to jack up healthcare costs for everyone. Rural hospitals in my state are going to close and people are going to die. We know this bill is catastrophically bad because of what it's going to do to the more than 10 million Americans who are at risk of losing access to food because of the biggest cuts to SNAP in American history. We're talking about kids, about veterans, about hardworking people all across our country and in the most rural parts of my district, in Berlin, in Stewartstown, in Winchester. People are going to lose access to food. And for what? To give another big tax giveaway to big corporations and to billionaires. This bill also is going to bring about the biggest deficit increase in American history, $3.8 trillion, and that's trillion with a T, according to the nonpartisan Congressional Budget Office. And it's going to add trillions of dollars to the national debt. So this bill is bad for all the things it will do. But one of the things this bill will not do, and another reason why it's catastrophically bad, is what it fails to do to really make government work better for hardworking people and to actually cut down on waste, fraud, and abuse. And that's where my straightforward, common sense, one-sentence amendment comes in. Title II of this big bill provides nearly $150 billion to the Department of Defense, and does this, mind you, at a moment when that department is in a state of pure and utter chaos under the leadership of a person who has no business serving as the Secretary of Defense. That's a lot of money, $150 billion. It's 10 times the state of New Hampshire's biennial budget. It's also, I should note, $50 billion above what the House Armed Services Committee was instructed to spend in this bill. And I read every bill I vote on, and it's $50 billion above. So I'm offering a straightforward amendment. It's one sentence that would simply require the Department of Defense, before it is able to spend the additional $50 billion, to do what it is already required to do by law and what it has failed to do under law for decades now, and that is to pass an independent audit. This is about basic government oversight, but the Department of Defense has failed 7 audits. It is the only federal department that has failed an audit, and it also accounts for more than half of our discretionary spending. We're talking about $1 trillion. This is not right. If you really want to talk about cutting waste, fraud, and abuse, I'd ask the question, isn't ensuring a clean audit of the Pentagon a top priority? If you want to know whether we're actually wasting money, an audit is going to help us do exactly that. So look, at the end of the day, it's about military readiness, and that's something that our national security depends upon. It's something our economic security depends upon. It's also about the public's trust. Small businesses across this country, people across America, have got to pass an audit to keep doing what they do. The Pentagon should be held to the same standard. And it's the public's trust that our democracy depends on. And so with that, I would say this big, truly big and catastrophically bad bill cannot be cured with one amendment, but this is a step towards progress on what I think we all share, a goal we all share, cutting waste, fraud, and abuse. That is not what this bill does. And with that, I yield back. Thank you.
You're recognized for 5 minutes.
Madam Chair, Ranking Member, members of the committee. Before I get started, I just want to observe that we've been here for almost 12 hours, and I want to take a moment to thank all of the staff who've been holding it down for the last 12 hours in this room. And I want to also observe that I count exactly 2 Republicans in this room, while literally dozens of Democrats have sat here all night and all day to have 5 minutes in front of this committee to speak our piece on behalf of the American people. So I have a lot of ground to cover. If it's not obvious already, not only am I a no on this bill, I am a hell no. Let me tell you why. This bill puts a massive permanent tax break in place for the ultra wealthy and corporations on the backs of working Americans. It will literally make the poor people of this country poor while the rich get richer. It will give billions of dollars in kickbacks to defense contractors, private prisons, and big tech. It gives cuts to life-saving programs, Medicaid and healthcare, which all of you said you wouldn't cut for months, and here we are. Food assistance, school lunches, Pell Grants. It will decimate protections for the environment, NEPA, public lands, judicial review, climate and clean energy. It decimates protections for our federal workers. It makes them at will and it threatens their retirement. It threatens our consumers. It eviscerates the federal budget. And, Madam Chair, despite what I have heard here for many hours of lying, it will put into place the largest increase in deficit spending this country has ever seen, ever. That is what this bill does, and that is why I oppose it. I'm here to present 6 amendments, one of which was voted down by the Republicans in oversight that would actually protect Medicaid, Social Security, veterans benefits, and food assistance. I'm also here to fight for a bill, an amendment to this bill that would make it impossible for people like Elon Musk and special government employees to self-deal and exploit the government for their own personal gain. I'm also here to present an amendment that would restore the protections for our tribal nations, because notwithstanding what I heard the chairman say in the dark of night in this room, this bill takes away the judicial rights of our tribal nations to defend their sacred lands and their tribal trust and treaty responsibilities, and it is shameful. It is absolutely shameful. I am also here to offer an amendment to restore climate funding that was cut out of our national budget. And I am here to present an amendment which the Republicans have already voted on in a number of different places and spaces that would make it impossible for our foreign adversaries to mine here in the United States and take advantage of our system. These are but a small offering to a 1,000-page bill that will literally kill Americans. This is but a small offering in the 500 amendments that my colleagues and I have waited all night and all day to present in this committee. So let me be perfectly clear. This bill will hurt the American people. It will raise the debt. It will give permanent tax breaks to the ultra wealthy. It will put billions of dollars into the pockets of Donald Trump's friends. It will cut life-saving programs. It will decimate protections for our communities. And it is happening on your watch. And we are here to fight it every step of the way in this committee, on the floor, in our communities, and we will not stop fighting. And with that, I yield back.
Thank you, Chairwoman, and thank you, Ranking Member McGovern. And thanks to all the staff, I agree as well, who've been here. I got here around 3 in the morning, and I echo what many of my Democratic colleagues have said. But I just have to say, as a preamble, you know, many of the things I've said won't be repeating others, but my heart is heavy. As a freshman member from Maryland, but grew up in this great state of Idaho and have lived here for 30 years. I've never seen anything like this in Washington. And I must say, I ran on common sense, common ground in my campaign, and there's none of that right here on Washington, on Capitol Hill. But that takes common ground, takes shared truths, and starting at least the same platform and the same set of facts and shared value outputs. And I would think that we should come back together to really look at those things. The way in which we have not been able to really have hearings and an ability to really think and probe into all these issues is so important going forward. So my amendment, H313, is really about ensuring that children and families will continue to receive the food they need despite the proposals put forward in the package. In this country, I do think that we all agree, and many of my colleagues on both sides of the aisle on the Ag Committee believe that no child in this country should go hungry. My Republican colleagues repeatedly said that this package would not result in the kids going hungry and that benefits would remain whole for them. My amendment takes them at their word, and it seeks to ensure that no cuts to SNAP can be made unless the USDA and states confirm that these cuts will not lead to a reduction in benefits for households with kids. Taking Republicans at their word to prevent benefits that I would suspect they would want. In some nationally, 42 million currently depend on food assistance programs. And in my district, 1 in 9 households depends on SNAP. Half of them are children. This isn't just about ending hunger. It's about dignity. It's about opportunity. And it's about being able to concentrate in school and being able to thrive. And if you want to talk about economics, as we said before, SNAP pays for itself in economic benefits and health benefits. For every dollar in my district, but across the country, spent on SNAP, $1.50 comes back into our economies. And that means many of my farmers in District 6 sell into the food markets. It goes back to 2,700 national retailers and back to our truckers. Cutting SNAP hurts, not helps our national economy. And these cuts will even be more apparent in rural communities. And by the way, in rural communities, there is going to be a tsunami of issues that is going to impact them, not just with SNAP, but with Medicaid and all these core funding cuts. And it's going to hit our states as well. So let me just put another thing in it, and maybe it's the lawyer in me, but I dispute the GOP constant messaging that this is about financial discipline and tackling the deficit. None of these cuts to SNAP or to Medicaid or social net programs result in this objective. The numbers do not add up, because we all know that it is widely acknowledged that this current proposal is projected to increase the budget by nearly $3 trillion through 2034 by locking in tax cuts and spending increases that outweigh reductions in Medicaid and SNAP funding. So let me put a finer point on this. It will strip $18 billion in benefits from households with children. It will harm 1 in 5 kids who rely on SNAP, and it lowers the age by which a child is considered dependent from 18 to 7. No one I know would argue that an 8 or a 10 or a 12-year-old is not dependent on their parents for food, housing, or care. And the authors of this bill have exempted families within this new definition of dependent only if they are married or living in the same household. But what about single or unmarried parents who are doing their best? This bill leaves them behind. Last, the bill prevents future increases to the Thrifty Food Plan. $37 billion will be cut from food assistance for the next decade, and that includes slashing $1 billion from summer EBT, which is a lifeline for millions of kids as they head into summer. I repeat, children will be hungrier over the summer. So it's about feeding our kids and about their future and our country's future. If you'll also allow me, Chairwoman Fox, I do not serve on the Energy and Commerce Committee, but I spent the bulk of my life as a child advocate at Common Sense Media. Common Sense is a nonprofit dedicated to looking at how media impacts the health and well-being of our nation's children vis-a-vis media. And the reports that came today about Sykes Bill H215 is really important, because we have to stand ahead of making sure that AI and the most recent proposals that it would block states from regulating it is really, really important not to. 140 organizations have already stepped against it. And I would also say for our nation's kids, we need to look at that. In closing, thank you. I yield back.
Thank you so much for this opportunity. And I echo so much of what my colleagues have said, but I want to bring my district into this room. They're never going to be able to sit here in this audience and express just anger that they feel that yet again, we're turning our backs to them and not putting them before polluters, billionaires, and so much more. The reality is, and Madam Chair, and this is to everyone here, it is not just us saying it. It's nonpartisan organization looking at the numbers, looking at this budget. And it is our residents of all different likes, because to me, Medicaid is nonpartisan. I have met people of all different likes and backgrounds that are dependent on Medicaid. I have met so many people that are on SNAP, Madam Chair, and for all of my colleagues to understand, you all know many of our residents survivor mode. I'm not going to here to do shaming and blaming. The reality is we have broken systems in place, and we wonder why people look at Congress and shake their heads and the approval ratings are so low. It's because we don't put them first. And so I offered 6 amendments, Madam Chair, and I hope you all seriously take them into consideration. I have no health care cuts for moms and babies. This is important. As a founder of the Congressional Mamas Caucus, when I look at over 40% of births in our country are covered by Medicaid, but that's also prenatal care, postpartum. I mean, all the different things that you see. And I say this because, again, I'm bringing my district here. We have one of the worst infant mortality crisis. And I mean, look at the crisis that we have in our country, but even in my backyard. And it's because we don't have the kind of care that we have. And Medicaid is a Band-Aid, y'all.
It really is. Because we do have an inhumane, cruel healthcare system that's driven by profit and greed and not about healthcare. That's why a lot of my residents don't even call it a healthcare anymore. They call it sick care, Madam Chair. And so now we're about to rip the Band-Aid off. So my amendment says, do not cut prenatal and postnatal care. Again, tackling infant mortality is nonpartisan. Every community is again seeing that our children are not reaching the age of 1, and there's a reason to that. And again, it's because we're not doing our job here in Congress. You know, the other amendment, and it's super important, is no money for polluters. I want to reiterate to all of you again, my community, the majority of them are frontline communities. We have one of the worst air qualities in the state of Michigan, in Wayne County, that I represent, and we're making people sicker. And then now we're saying, you know, we're not going to cover the fact that, again, we've allowed corporate polluters to be unchecked. You should see the lack of enforcement because the bills are written in a way they slap their hands, they pay a fine. It's part of doing business. But when you go to read a third grade class in my district, and I always tell them, you know, they ask me what my job is, and I tell them I'm trying to make sure we have clean air and how many of you have asthma. A third of the class will raise their hand, Madam Chair. A third of them. And you look at the attendance rates and so forth. The other is really important. I really believe that we need no more aid to billionaires. I'm calling it that because I think that's how you all see it. They don't need it. The corporations don't need it. Some of them have not paid federal income tax for years. They don't need it. They're going to be okay. I promise. But you know, I still remember the first Black woman ever elected in Congress, Shirley Chisholm, say that children can't learn if they're hungry. And I'm telling you, that is very real, but also children can't learn if they're being poisoned because they don't have clean water or clean air. And so I think it's incredibly important. My other amendment expand but don't restrict Medicaid. You know, it is important to understand the importance of what Medicaid does right now. Again, the Band-Aid that I talked about, and we try to keep it tight. I know all of us that are fighting for Medicaid and making sure that we're expanding it and making it, again, closer to something a lot more humane. But I think it's incredibly important to understand this is life-saving. I've never had this many people in my community call me, parents with special needs children, petrified. They're so scared that we're gonna put Amazon and FedEx and all these other corporations before them. That's what they're afraid of. And we wonder why they're so angry. My other amendment, again, is around no money for Pentagon, because I want to talk to you all about this. In my community, I tell them, don't worry, guess what? Guess what? There is one budget that got an increase. Which budget is that? The Pentagon budget. Can't pass audits, Madam Chair. 7 audits in a row. The last audit, the last failed audit, showed that over half of the assets of the Pentagon are unaccounted for. Unaccounted for. So we have money for bombs and wars. And shame on any of my colleagues that own stocks in war manufacturing. You shouldn't be voting on this bill. That's a conflict of interest. But Madam Chair, it's important to understand, we can't prioritize to build ships that can't float, planes that can't even fly in the rain. Trillions of dollars are going to that. And we're going to go ahead and fund it $150 billion more dollars into talk about waste and inefficiency. It is cruel for us to put more money in a budget that can't pass an audit, but we're going to go ahead and throw people off of Medicaid and SNAP. With that, Madam Chair, I yield.
Thank you. Thanks to all of you. Let me see if there are questions. Do you have any questions? No. Okay, Mr. McGovern.
Yeah, Madam Chair, first I want to ask you to consent to insert into the record a letter from Jacek Furman, an economist and the former chair of the Council of Economic Advisors and the deputy director of the National Economic Council. In his letter, Mr. Furman shares an outlook of what this horrible bill will mean for our economy. And he writes, and I quote, "The legislation would drive up mortgage interest rates and inflation, lower economic growth, and ultimately require Congress to pass additional tax increases or benefit reductions. All of this would further hurt the working and middle class." So, Madam Chair, more expensive mortgages, higher inflation, basic needs like food and health care ripped away from people in need, all to give us more tax breaks for billionaires. I think it's shameful, and I think this bill will actually will hurt real everyday people. I ask unanimous
Without
consent.
objection.
And then the other thing I'm going to say is, I mean, let's remind ourselves why we're here, right? We're dealing with a bill that does a a million different things. It's so wide in its scope. But I mean, I think what has kind of brought us all together is our deep concern over people losing their health care, people losing their food assistance, all to pay for tax cuts for billionaires. And that's just unacceptable. And I mean, we wouldn't be who we are as Democrats if we didn't fight this with every ounce of energy we have. There are other things in this bill. Ms. Bonamici, I'm glad you brought up the AI aspect of this. I am scared out of my mind that there will be a 10-year moratorium on states' ability to be able to kind of regulate AI in their within their boundaries. Congress should do it, but we can't get our act together here. So the idea that we just we'll let it go wild. I mean, there's some real dangers to our kids, to our communities, and so I thank you for raising that. But again, you know, I mean, I'm grateful to all of you for sticking this out. You know, we have been talking amongst ourselves about how incredible it is to see all of you just stay here and remain here in solidarity and to, you know, be able to present your amendments. I think the American people appreciate it. And so I support all your amendments. Again, I thank you for being here. I yield back my time.
Okay, thank you. I just want to echo the ranking member's remarks. There are dozens of members still waiting. We really, really appreciate your passion, your amendments, which are so well taken. Everybody bringing their expertise that would have been probably better served if we'd been able to use regular order, use committee structure to try to work on consensus bills. But it is so important that your constituents hear what you would do if our colleagues across the aisle were willing to work in a bipartisan manner, and just how much we could accomplish if that were an option around here. So thank you all. Appreciate it.
Mr. Neguse, you're recognized.
Thank you, Madam Chair. I don't have any questions. I just would, again, share the sentiments expressed by our ranking member and Ms. Scanlon, and our deep appreciation to our members of the House Democratic Caucus for hanging in and staying as long as you have. Again, we started this hearing at 1 a.m. It's now 1 p.m., so 12 hours later, and there are a number of you who have been here the entire time, all so that you could, as Representative Stansberry so eloquently put it, speak for 5 minutes on behalf of the communities that you serve, and to present very thoughtful, exceptional amendments that are developed by virtue of your expertise in your particular areas of expertise. And so I would just say thank you, and I hope that our colleagues on the other side might perhaps reconsider the closed nature of the rule. I suspect they won't, but hope springs eternal. So I thank my colleagues for being here.
Thank you, Mr. Neguse, and thanks to all of you. I also thank you for coming and staying for this period of time, and you're now excused. Mr. Jackson, Mr. Fields, Ms. Dean, Ms. Schulten, Mr. Mervan, Mr. Tonko, Mr. Mannion, Ms. Wasserman Schultz. If you could come into the seats these people are vacating, please. Thank you very much, Mr. Fields. Ms. Dean, you're recognized for 5 minutes.
I thank you, Madam Chair, and I thank you, Ranking Member McGovern, and my Democratic colleagues for your endurance and for being here, standing watch over this proposed budget, this proposed reconciliation, and the disgraces that are within it that we've really yet to uncover. You know, Madam Chair, I had a very wise and funny godmother. Her name was Joan Casson, and she used to say to me, Mad, remember, nothing good happens after midnight. So I came here in the middle of the night to see if Joan Casson was correct. And I sat here for hours and hours in the dark of night as members struggled to even stay awake because you noticed this hearing in rules of one of the most important, big pieces of legislation, I won't call it beautiful, that we will vote on this year. One of the most important. And I am baffled that you called this important hearing on this important legislation that you all seem to, well, some of you seem to prize, for 1 o'clock in the morning. Joan Casson was right. Nothing good, nothing that you're proud of happens after midnight when you call such a hearing. A couple of things that I wanted to talk about, they are by way of amendment, but really they're just by way of my heart. There is an amendment that our colleague, Mr. Thompson, is offering, which will strike, this is, bear with me, this is a double negative. I hate double negatives. It strikes the removal of the $200 tax on silencers. Right now, and this is since 1934, there has been a $200 tax on silencers, never adjusted for inflation. It's been solid since 1934, but I believe it's Mr. Clyde who wants to die on this hill. Well, others might die on this hill. He wants to remove the tax altogether. Baffling to me. And you know what the dollars are? It's $1.4 billion over 10 years. I did the math. That means something like 700,000 silencers are sold in this country a year. That baffles me. I don't know if that's accurate, but by the numbers and by the math, that's what we're talking about. In 1934, you know what $200 looked like, adjusted for inflation? It's at least $4,600, $4,700, $4,800 would be the tax if we did that today. Why do you think they put such a steep tax on that silencer in 1934? Take a look at the history. The history is the tax was used to try to discourage the purchasing of silencers. Well, this is a committee, this is an amendment, this is an initiative that Mr. Thompson will correct in his amendment, which I'm sure you're all going to go for, that would reduce the revenue, take us down $1.4 billion over 10 years, don't know why, and probably encourage the sale of more. Sounds to me like it is just to appease the NRA and to encourage the industry, all at the cost of our revenues. If we doubled it, if we just went to $400, you could sell only half as many and not lose a penny in revenue. If we tripled it, you might actually discourage some sales of silencers. Wouldn't that be a good thing for us to be doing in this committee? The other thing I want to talk about is substance abuse treatment and substance abuse dollars in Medicaid. In Pennsylvania, in my state, 100,000 Pennsylvanians have access to health care, recovery, treatment, 100,000 in Pennsylvania alone, thanks to Medicaid. What this budget proposes to do, slash that. Let those people go out in the cold. Let them try to find recovery on their own. Let them try to get a life worthy of what they want to become so that they can continue to work, provide for their families. 100,000 people are at risk. So I support an amendment that I know Mr. Tonko is going to be supporting also. He and I are co-chairs on really important committees, caucuses around addiction and mental health and fentanyl poisoning and all the rest. I come at it because I have a son in recovery. I want other families to have children in recovery, not dead. And so this proposed deep cuts to Medicaid make no sense whatsoever, especially at a time, Madam Chair, that I know you care about, at a time when we have reduced the number of overdose deaths in this country last year by 27%. That's something like 30,000 fewer people dead as a result. I implore this committee, make sure you pass this amendment, make sure you pass the Tonko amendment. Let's save lives from these scourges of gun violence and overdose death. I yield back.
Thank you, Ms. Dean. Ms. Schulten, you're recognized for 5 minutes.
Thank you so much, Madam Chair, and to this committee for your tireless efforts here, and to the incredible staff for supporting you through the night. As my colleagues have said here, I am just baffled at the reason this committee would start a hearing at 1 o'clock in the morning to hear amendments and testimony on a bill that has such significant impact on the American people. We are responsible to the American people, and transparency is at the heart of what we do. Republicans are doing this because they know that this is bad. It's the same reason why when the president pulled Republicans to the White House when there were holdouts on the budget proposal, that he told them just to close their eyes and vote for it. Just close your eyes and get there. The same reason the budget committee called people back at 10 o'clock at night to do this work in the middle of the night. Well, I'm not closing my eyes. I'm paying attention to every single thing that is in here that is going to hurt hardworking Americans like those back home in West Michigan who I represent. I am paying attention. And I'm offering amendments that will help take us down a different path. I've offered several amendments here today that protect working families, our Great Lakes that I proudly represent, the largest freshwater resources in our entire country. But we only have time to focus on one. So I'm talking today about my amendment number 66 that makes the Enhanced Affordable Care Act subsidies permanent. These subsidies are one of the most effective tools we have to make health insurance affordable for hardworking families, middle-class Americans, and those who fall into the coverage gap just above traditional Medicaid eligibility. This amendment eliminates the previous income cap that cut off subsidy eligibility at 400% of the federal poverty line so that no family is forced to pay unaffordable premiums just because they make slightly too much. It also maintains a sliding scale cap on how much of a family's income they're expected to contribute to their premiums, ensuring no one pays more than 8.5% of their income for coverage, and in many cases, significantly less. What does that mean? That means that a family of four making $125,000 a year can still afford quality insurance without facing crushing monthly premiums. It means a self-employed contractor with variable income isn't penalized for working hard. And it means that millions of Americans who don't qualify for Medicaid but can't afford private insurance have access to care. Without this amendment, those enhanced subsidies are set to expire at the end of the year. If you're at home listening to this and you thought this was all about Medicaid, think again. Your premiums could go up significantly. When these premiums expire, over 4.2 million Americans are projected to lose their health care coverage. That's according to the nonpartisan Congressional Budget Office. Millions more will see their premiums double or even triple. We are staring down a cliff, and my amendment pulls us back from the edge. In my home state of Michigan, these subsidies have helped hundreds of thousands of people afford health coverage. That includes families with children, small business owners, those who are self-employed and part-time workers. If we let these subsidies lapse, people in every single one of our districts, red and blue, are going to feel the impact. We better be paying attention. At the same time, this budget plan slashes nearly $1 trillion from Medicaid. As we know, those proposals that threaten coverage for nearly 14 million Americans, including children, seniors, people with disabilities, and low-income families. While one side of the aisle is proposing taking healthcare away, I am working to keep it. This amendment offers a responsible, proven way to keep people covered. Let's not forget, these subsidies work. We've shown that they work. They've reduced the uninsured rate to a historic low. They have brought down premium costs. They've given people peace of mind in moments of crisis, whether facing a chronic illness, job loss, or pregnancy. Making these subsidies permanent is not only the responsible thing to do, it's the moral thing to do. It's pro-family, pro-worker, pro-stability, and it is a fraction of the economic cost and the human toll that we will pay if millions of people lose their coverage. We need to be asking ourselves, why? Why are we doing this? We have the resources to cover the healthcare coverage that we need if we will just tell the billionaires that they need to pay their fair share. This tax plan will allow the top 1% to get an additional $700 a day.
Thank you, Ms. Schulten. Thank you. Mr. Mervan, you're recognized for 5 minutes.
I want to thank Chairwoman Fox and also Ranking Member McGovern for allowing us to be here. I offer up an amendment that would require the Medicaid and CHIP Payment and Access Commission to produce a study on the effect of the Medicaid title on out-of-pocket costs for services to prevent and screen for and treat cancer. The amendment would require the study to focus on individuals eligible for Medicaid or CHIP under the eligibility rules in effect on April 1st, 2025, and the health outcomes for such individuals. As a local elected official for 15 years, I was elected to take care of the most vulnerable populations. Those that couldn't afford or have access to healthcare during that 15 years would come to my office. We had 142 caseworkers that would work with individuals that were the most vulnerable populations. That being said, this is in my wheelhouse, and it's worth being here through the middle of the night marathon to make sure we're fighting for access for healthcare for all individuals. I specifically choose this amendment for cancer because each year I meet with NIC, which is Northern Indiana Cancer Children. And what their 300 families that they have provided for are worried about is losing access to health care for their children, losing access, obviously, for individuals with cancer as we reduce the numbers of people who are on Medicaid. I also, as a local elected official, have a very unique position where part of the process was work requirements. Well, what happens when a family member has a illness that is going to cause death? People stop working to take care of that family member. And if you have to provide proof each 6 months while you are facing a crisis in your family, that is going to be the last thing you do, which puts your health care at risk. And so ultimately, why I'm here offering up this amendment is because what my colleagues have talked about, the features and benefits of your bill are ultimately the most wealthy and corporations are going to get tax cuts where the most vulnerable are going to be punished. And ultimately, I leave with this message. The American Cancer Society, if we can agree upon one aspect of life, Chairwoman, the American Cancer Society has an ad on social media saying just to be specific, 1 in 3 children will have cancer, 1 in 10 adults with a history of cancer have Medicaid for their care. They're advocating against this bill because they know the impact of it. So ultimately, today, what I'm asking for is support of this amendment to make sure that the most vulnerable of populations have access to health care. And with that, I yield back.
Thank you, Mr. Mervan. Mr. Tonko, you're recognized for 5 minutes.
Thank you, Chair Fox, Ranking Member McGovern, and members of the committee. I appreciate the opportunity to testify on 2 of my proposed amendments. It is said that beauty is in the eye of the beholder, but I just don't see what Republicans find beautiful about this ugly bill. Is it the 13.7 million Americans that will lose their health care, children that will go hungrier, the energy bills that will go higher thanks to repealing critical tax credits? Clearly, Republicans can't be too proud of it. Otherwise, it would not have started this whole process at 1 a.m. in hopes of suppressing debate on its many, many flaws. Given the many problems with this legislation and the fact that it is being changed in the dead of night, I urge you to have an open rule so that all submitted amendments can be properly debated on the House floor. But short of that, I would ask you to make my two amendments, numbers 89 and 270, in order. 193,000 people in my district rely on Medicaid. That's 25% of all residents, including 57,000 children and nearly 20,000 seniors. Every single one of them will be impacted by this heinous package. These are not just numbers on a page. They are deliberate choices with real-world consequences, including real people's lives. And for what? Why are Republicans so hell-bent on cutting Medicaid and forcing people off of their health insurance? So rich people like Elon Musk can get a massive tax handout that they don't need? Amendment 89 supports continued access to behavioral health care through Medicaid. This amendment requires states to stop implementation of the red tape requirements included in the bill if access to substance use disorder treatment services amongst low-income adults decreases. You heard my colleague, Representative Dean, next to me here, speaking in favor of this amendment, and rightfully so. She knows the benefit that this could bring. This would be determined by the number of available SUD providers in the state that participate in Medicaid, the geographical distance for beneficiaries to access a SUD provider that participates in Medicaid, and the rates of SUD treatment amongst low-income residents of the state. Republicans want us to believe that these new paperwork and red tape requirements won't impact treatment for addiction and behavioral health. But Medicaid is the single largest payer for behavioral health services. These red tape requirements will rip coverage away from millions of individuals struggling with addiction and behavioral health needs. If these Medicaid cuts are put in place, states will be forced to take on more financial burden and may shift resources away from critical life-saving services, including prevention, treatment, and recovery. Additionally, most Medicaid enrollees struggle with substance use disorder and find their way to treatment after getting on Medicaid, not before. If a diagnosis is required before providing someone with access to Medicaid, then how do the undiagnosed ever get care? Under the Republican plan, they won't get access to substance use disorder treatment. Care will be delayed or never happen, and lives will be lost. This is a common sense amendment to ensure that Medicaid cuts won't prevent our loved ones living with substance use disorder from accessing the treatment they need. My second amendment, Amendment 270, would only allow the repeal of EPA's Greenhouse Gas Reduction Fund and rescission of its unobligated funds to take effect after GAO certifies that it will not increase costs on consumers. This program was designed to help Americans who are struggling with their energy bills by leveraging billions of private sector dollars to support projects that will lower costs and create good-paying jobs. To do this, EPA tapped into nonprofit coalitions of experienced community-based lenders. The potential benefits are massive. Recent analysis from the University of New Hampshire estimated that these investments will result in $52 billion worth of energy cost savings for consumers over the next 20 years. Despite these major benefits to everyday Americans, this bill would continue Republicans' ideological crusade against the program to help offset the cost of tax cuts for billionaires. Let's be clear, there has been absolutely no evidence of fraud or criminality by grant recipients. In court this week, attorneys for the administration admitted that we're not accusing anybody of fraud and there aren't any particular instance of waste and abuse. This bill doubles down on the Republicans' longstanding policy objective of undermining the program, having sought its repeal on numerous occasions. At the moment, only $19 million of the original $27 billion remains unobligated, which is intended to be used to administer and conduct oversight of the grants. If Republicans were genuinely concerned about the program's risks for fraud, waste, and abuse, they would not be rescinding these oversight dollars. Americans are struggling with the cost of living. Energy bills, despite President Trump's promises, are going up. It's outrageous that Republicans would target funding and reduce energy bills at this time. So let's make certain we go forward, support these amendments in order, and defeat this ugly bill. And with that, Madam Chair, I yield back.
Thank you, Mr. Tonko. Mr. Mannion, you're recognized for 5 minutes.
Thank you, Chairwoman. Thank you to the ranking member and members of the full committee. I Appreciate the opportunity to testify today and offer Amendment 156 for your consideration. This amendment is simple. It says none of the changes in the health title should go into effect unless the Congressional Budget Office can confirm they won't raise out-of-pocket health care costs for working families. That's it. That's a whole thing. And to me, it's just basic accountability. I represent New York's 22nd Congressional District, a true 50-50 district, Republicans and Democrats living side by side. And right now, I'm hearing the same thing from all of them. Fear. Fear that changes in this bill could jeopardize their ability to pay for their care. Fear that their kids or aging parents will lose the services they depend on. Let me tell you about Betsy, a mom who has a child on the autism spectrum and has Tourette's syndrome. He has significant needs. And through Medicaid, he's been able to access therapists, medical providers, and a communication device that gives him a voice. And that's not an exaggeration. His device is literally how he speaks to the world. And through these services, her son has built independence. He's learning to thrive. And as Betsy put it, this is how he lets the world know that he's a fighter and he deserves to live a full, meaningful, and enriched life. But if we cut Medicaid services, what happens to families like Betsy's? What happens to a child who literally loses their voice? Because we can't take the time to understand the impact of this legislation. So this is a common sense amendment that ensures that we're not balancing the budgets on the backs of the families who can least afford it. In Central New York and the Mohawk Valley, we are common sense people. It's common sense to support this amendment. It's common sense to reject a $400 million gift from a state that sponsors organizations that carry out terrorism, potentially against our allies. It is common sense to investigate the creation of meme coins and stable coins to enrich those in positions of power and their families. I urge the committee to adopt this important amendment, and I yield back.
Thank you, Madam Chair, my classmate. It's good to see you, and thank you for the opportunity to present amendments to this bill. For months, Republicans promised repeatedly that their budget would not affect Medicaid, would not make any cuts to Medicaid, and that no one would lose their Medicaid. It's the same promise Donald Trump made on the campaign trail among his countless other lies. Well, here we are about to bring one big ugly bill to the floor, with this committee hiding behind closed doors in the dead of night when presenting the details of this harmful legislation. Republicans are trying to ram through a slew of dreadful policies that will weaken our country, economy, communities, and families everywhere. This bill is pure cruelty. Republicans and President Trump lied to people all over America, and millions will lose their Medicaid coverage. The CBO confirmed this. It is a fact. Therefore, my First Amendment strikes the provision limiting state-directed payments, which I know worries many of my Democratic and Republican colleagues alike. State-directed payments are a lifeline for hospitals, nursing homes, and other providers in our safety net that treat a high volume of Medicaid beneficiaries. Medicaid often reimburses providers at rates below the actual cost of care. In Florida, Medicaid repays providers at about 48 cents for every dollar spent to provide care. This is why states like Florida have these agreements in place to address the shortfalls for hospitals that operate on razor-thin margins and need help bridging that gap. The Republican bill before us today would hamstring states, ironically, most of them red, by taking away their ability to manage their programs effectively and removing needed flexibility. This will have a cascading effect. Providers will be harmed, then be forced to limit services, which negatively affects Medicaid patients. And where will the Medicaid patients turn? To the emergency room. And that, of course, hurts hospitals even more because it's the costliest point of entry into our healthcare system. This will make healthcare pricier and harder to find. In other words, working families pay for Republican tax cuts to the wealthiest by giving up their own health care. That's why my First Amendment strikes this provision so that the safety net hospitals in my community and the people they serve in my district don't suffer needlessly for the benefit of the wealthy. And this affects hospitals across the country, and many will close as a result of this change. Mark my words. Moving on, my Second Amendment is deeply personal to me because many of you know I'm a breast cancer survivor. and we have millions of other cancer survivors in this country. I know what it feels like to wake up every morning not knowing what the next scan will show, not knowing if I'd be there for my children's next birthday, or see them grow up, get married, and maybe have their own kids one day. And it shatters me to know that this bill will harm people who are grasping for hope, desperate to survive this terrible disease. My amendment prevents this horrible, ugly bill from taking effect until the HHS secretary certifies that not one of its provisions harms cancer patients and their access to care. Over 10% of cancer survivors rely on Medicaid for their care, and more than 1/3 of children newly diagnosed with cancer in our country are enrolled in Medicaid or CHIP. Medicaid is a lifeline to so many cancer survivors, and they don't need any obstacles or uncertainty to accessing their care, nor do they need to struggle just to stay alive. Also, Republicans can stuff more big tax breaks into the pockets of big corporations and the super rich. Survivors who rely on Medicaid will die because of this bill. Full stop. It's shameful. You want to talk about saving taxpayer dollars? Then fund early screening, fund treatment, help prevent advanced stage cancer, because we all know that preventing diseases like cancer and catching it early, as I was able to, is far less costly than treating it when it has advanced and spread. Access to insurance saves lives and lowers costs. I know you know that, but you simply don't have the courage to stand up to Donald Trump and defend your constituents for fear he'll tweet a primary opponent for you. And spare me the excuse this bill only kicks off ineligible people from Medicaid. That is false, and you know it. This moment calls for courage, not self-interest. It requires a heart, not a headline. There are 110,000 people in my district who are at risk of losing their Medicaid health care under this terrible bill. A majority of them are children. Nearly 30,000 are seniors. And I'm up here I'm sorry, I've been here since the middle of the night, fighting for them. Why? Because Republicans turned their back on the people that you represent. You have to push this midnight madness because you're putting your constituents in dire situations, and you want to block them from defending themselves. And you want to ensure they can't by yanking their health care while they're sleeping. I know how important Medicaid is to so many Floridians and people across the country, and I swear I will defend it to my last breath. So I ask each of you, would you vote for a bill that could take away the care of a loved one facing cancer when they needed it most? Hide in the dark if you want, but history is watching, and the people that we all serve will remember how you answered. I yield back.
I'm going to take a point of personal privilege and ask Mr. Jackson if he would, there are three of us who attend prayer breakfast regularly with you. Would you like to invite other people to go tomorrow morning, Mr. Jackson? I give you a point of personal privilege.
Thank you so much. Yes, I'm the bipartisan co-chair of the National Prayer Breakfast. I would like to invite all of my colleagues out for friendship, fellowship, and exhibit of faith. Please join us tomorrow morning, 8 a.m. in the here in the members' dining room, and let us pray for the food we're about to receive, not the food that has left our table.
Thank you. Mr. Norman, do you have any questions? Mr. McGovern?
I don't have any questions. I support all of your amendments. You are like my heroes for lasting as long as you have and being here, because I think it's important to remind the American people that there's a lot in this bill. I mean, everything from the repeal of the tax on silencers to the issue about making sure that people get adequate health care, especially young kids when they're diagnosed with cancer. And again, I just think it's such a profoundly bad bill that is going to hurt so many people. And I think, we just need to make sure that the American people know that we're on their side. And so I thank all of you, and I yield back my time.
Thank you, Mr. McGovern. Ms. Scanlon.
Thank you. Again, I want to thank you all for your willingness to tough it out here with us as we're now on hour 13, which is so much fun. But I really appreciate the attention and the care you've brought with your amendments, thoughtful amendments to try to improve this bad bill and to highlight the economic, the environmental, and even the existential harms that it's likely to cause the American people. Especially want to thank my sister in service to Southeastern Pennsylvania for the life-saving amendments that she has introduced to reverse cuts to substance use disorder services and to address this tax cut that would make it easier to purchase silencers for firearms. So thank you all.
Thank you, Ms. Scanlon. Mr.
Sorry,
Scott?
I yield back.
First of all, Madam Chair, Mr. Jackson, I appreciate the invitation and especially the optimism that we may be done by the time the prayer breakfast starts tomorrow. I would just point out that there's a lot that's been said about suppressors with modern printing, 3D technologies, everything else right now. You can go on Amazon and buy all the parts to make anything you want. So I think there's either way, it's unrealistic to think it can be stopped once the technology has reached the level that it has. And in many countries, it actually mandated, in many countries, it's my time. In many countries, it's actually mandated that you use a suppressor if you're gonna hunt. With that, I yield back.
Thank you, Mr. Scott. Mr. Neguse, you're recognized.
No questions, Madam Chair. Just again, gratitude to our colleagues for being here and for submitting your amendments, all of which, of course, we agree with and support. And I'll yield back.
Okay.
Thank you, Madam.
Mr. Griffith.
Oh, sorry about that.
That's all right. Well, you never know what I'm going to say. Today, I'm going to echo the chairwoman's comments and encourage everybody, whether it's this Thursday or any Thursday we're in session, to attend the bipartisan prayer breakfast. It really is a good group. But one thing that has not been mentioned yet is that for those of you like me who love to eat, one of the regulars provides breakfast every Thursday morning. So we have eggs and oatmeal and sausage and bacon and potatoes. It's good. It's a good time to get together and reflecting that we all have losses from time to time. Today, of course, the loss of Jerry Conley. It's sometimes good to get together, not as adversaries, but just getting together as human beings who care for one another. I yield back, Madam Chair.
Thank you. Ms. Ledger Fernandez.
Thank you, Madam Chair. And I really do want to thank both all the members of this panel, the previous panels, and the people who are waiting to speak. Because I want to point out that because of all of my Democratic colleagues, we did prevent them from passing this bad rule in the dead of night. You have made sure that the sun is shining on this process. And you are, by the way, I think the third panel and ABC. There are nothing but great C's that I have heard in this. We have talked about corruption and the need to fight it, about having the courage of standing with your constituents, about cancer. And the fact that we can do something about it because we know what it feels like. Today of all days, we know what it feels like when you lose somebody to cancer. We've talked about the cruelty of the bill and the importance of care, which I think ties into the idea of the prayer breakfast. Care. Care for others, the elderly, those with mental health issues, those who need help with drug addiction. So thank you, this third panel, for enlightening us as to all of these subject areas. Muchísimas gracias.
Thank you. Thank you, Ms. Ledger Fernandez. And I thank the panel for being with us. And there being no further questions, you're excused. And I will ask Ms. Berrigan, Ms. Randall, Mr. Larson, Mr. Whitesides, Mr. Caston, Mr. McGarvey, Ms. Trahan, and Mr. Danny Davis to come forward. If some of you would go down before you click. All right, here. I know some, but I don't know more. We're missing. Let me see. McGarvey. Who? Budzinski? Budzinski, if you would come forward. You dropped something. Thank you. Got it. I'll recognize you in the order that I called out your name. Some people want to know what order you're in. So again, we're just doing it by the names that are given to us. Ms. Berrigan, you're recognized for 5 minutes.
Thank you, Madam Chair. I have an amendment titled Health FCD AMD 88. My amendment removes red tape and improves access to the Children's Health Insurance Program, also known as CHIP. Let me be clear, this amendment does not expand CHIP eligibility. It simply makes sure that kids who are already qualified can actually get the coverage they need and keep it. That's it. CHIP provides low-cost health coverage to children in families who earn too much to qualify for Medicaid, but not enough to afford private insurance. When kids have health coverage, they do better, not just in childhood, but for life. They're healthier adults. They attend school more regularly, and they succeed more in the classroom. My amendment takes two simple, powerful steps to protect kids. First, my amendment ends waiting periods, because when a child loses coverage, they shouldn't have to sit and wait for care. Right now, 9 states force children to wait up to 90 days before they can enroll in CHIP, even after they lose coverage. 3 months with no access to checkups, a prescription, or a specialist. Imagine being a parent in that position. These gaps can result in delayed treatment and increased financial risk for families. Some of the states that impose waiting periods also have the highest rates of uninsured children in the country. It's cruel and unnecessary. Second, my amendment ends annual and lifetime limits on benefits. In 13 states, kids enrolled in CHIP can face strict limits on the care they receive, including limits for dental care. That means even if a child needs treatment, their plan may stop paying once they hit a cap, not just for the year, but for their entire life. Limits like this are not allowed under most insurance programs, and it shouldn't be allowed for children under CHIP. It's unfair. Let me tell you about Emily Dent, a mother from Cape Coral in Florida's 19th Congressional District. Emily's 8-year-old son, James, was kicked off of Medicaid because their family's income was too high. But leaving James uninsured is not an option. He has a rare genetic disorder. It's called Pulaski-Killen syndrome, and he relies on round-the-clock care from a nurse. Emily, his mother, said he has to have health insurance, but it's going to drain my savings, which was going to be to save for a house one day. For families like Emily's, higher healthcare costs would mean a breaking point. Why should she have to choose between children's health care and other essential needs like housing? This is why it's so absolutely vital that we take steps to protect CHIP today. So there's an option for kids like James to have health care. CHIP and Medicaid work hand in hand together to cover kids from low and middle income families. Together, these programs cover nearly half of all children in the US. When Medicaid is cut, CHIP suffers too. States could impose new or higher CHIP premiums and cut people's access if they failed to pay. States could cut CHIP benefits, eligibility, or outreach to deal with budget shortfalls. Or doctors in hospital could get paid less, which means longer wait times and fewer available providers for kids. In this budget, Republicans are gutting hundreds of billions of dollars in Medicaid funding, failing to extend enhanced premium tax credits for the ACA marketplace, making it harder for kids to access CHIP coverage. This is a triple blow to working Americans' access to health care, and kids will suffer, all to pay for billionaire tax cuts. No parent should have to choose between paying the bills and getting their child the health care they need. Right now, kids face dangerous and unfair waiting periods and lifetime limits on their care. Why shouldn't we fix this for children? My amendment is simple. It says kids shouldn't be punished with unfair rules just because their families are struggling to make ends meet. Every child deserves a healthy start. I urge this committee to adopt this amendment, not for politics, but for children who depend on us to do the right thing. I yield back.
Thank you, Ms. Berrigan. Ms. Randall, you're recognized.
Chairwoman Fox, Ranking Member McGovern, members of the Rules Committee, thank you for the opportunity to testify on the Republican budget scam. Well, it's deeply unfortunate, Madam Chair, that you chose to begin this hearing literally in the dead of night to try and hide from the American people. It's daytime now, and my Democratic colleagues and I remain here and continue shedding light on the harms of this big, bad bill that only benefits billionaires. An estimated 15 million Americans stand to lose their health care because of this deeply unpopular bill you're trying to jam through. My Republican colleagues are gutting Medicaid, which will destabilize hospital systems across the country, especially in rural communities like mine, but not only mine. Ms. Houchin, I understand a hospital in your district is projected to lose $2.5 million in revenue under this proposal. And
Madam Chair, it's my understanding that in debate, and maybe I'm not sure about testimony, but I just want to ask for a point of clarification if members are allowed to refer to panelists, members of this committee by name.
Okay. Apologies. It's my first time before the Rules Committee. Yes, right.
If
yeah,
you
that's okay.
can you can refer to other members by state.
Right, okay. Appreciate the clarification. Thank you. And there are other colleagues on this panel whose hospitals stand to lose $884,000 from this proposal. So many of our hospitals are on the verge of shutting their doors because of this bad bill. Just yesterday, President Trump even told your conference, don't F around with Medicaid. He seems to know what members on this committee aren't willing to face up to. That so many families like mine depend on Medicaid, which is why I've filed an amendment to prevent provisions in this bill from going to effect if this administration makes any cuts to Medicare or Medicaid. Beverly from Tacoma called my office telling me that losing Medicaid will literally kill her as she has multiple surgeries she needs to have this year. Another constituent, Kelly, is worried that her daughter will be homeless if she loses Medicaid coverage. Evangeline wrote me saying, as someone with a husband who is 83 years old, a kidney cancer survivor, and living with dementia, the importance of maintaining these healthcare services cannot be overstated. They're vital for seniors and those with chronic conditions to receive necessary medical support and assistance. It's not just Medicaid that's at risk. Millions stand to lose health coverage because the majority is not extending the ACA's enhanced premium tax credits, which my constituent Denise wrote me about, saying she has lupus and she won't be able to afford health insurance and treatment without those benefits. For the American people watching at home, because Madam Chairwoman, despite your attempts to deceive the American people by beginning this meeting in the middle of the night, know that they are still watching this majority's every single move. And the bottom line is that this bill will make your air dirtier, your water filthy, and dismantle the healthcare system so that when you inevitably have health complications from all this increased pollution, you won't even be able to afford treatment. All so that Republicans can finance trillions of dollars in tax cuts for wealthy and well-connected people. While President Trump and his friends get jets and giveaways, he wants Americans to be forced to choose between feeding their families and paying for prescriptions. I won't stand by and watch it happen. I urge the members of this committee to follow the president's direction to protect and preserve Medicaid, stand up for healthcare access in the hospitals in your communities, and support my amendment. These cuts to Medicaid are just the beginning of harmful provisions in this bill that I'm concerned will hurt my neighbors back home.